Just another moment, colleagues. Colleagues and public, welcome to the 14th special meeting of the Strategic Priorities and Policy Committee. This is a virtual meeting during the COVID emergency. I'd like to advise that City Hall is open to the public with reduced capacity and physical distancing requirements. Meetings can be viewed via live streaming on YouTube and the city website. The City of London is committed to making every effort to provide alternate formats and communication supports for council standing or advisory committee meetings and information upon request. To make a request for any city service, please contact accessibility@london.ca or 519-661-2030 2489, extension 2425. To make a specific request to this meeting, please contact sppc@london.ca. Colleagues, I'll look for any disclosures of pecuniary interest. Councillor Turner.
Thank you, Your Worship. I'd like to declare a pecuniary interest on this file, as the Council will be seeking advice from the Middlesex London Health Unit. The Middlesex London Health Unit is my employer.
So noted, thank you. Any other disclosures? Seeing none. I have nothing on the consent agenda nor scheduled items, but on items for direction, we're fortunate we do have some items. We have additional, under 4.1, additional legislative measures to reduce the risk of further COVID-19 infections in the City of London. We have one presentation and two communications. For your minutes, I will look for a motion to receive. Not yet? A better suggestion than my own. I'd like to call Dr. Mackey up. He has a presentation, and we'll turn the floor over to him. Dr. Mackey, if you would, please.
Thank you, Mr. Mayor, for the opportunity, and to all of Council for inviting this presentation today. I understand the slides won't go directly to those who are remotely working remotely, so I'll try to keep people updated as we go through. Is this visible to at least some people?
Okay. And I'd mentioned, Dr. Mackey, that councillors have this in their package as well.
Perfect. So I understand, so this technology isn't connecting, unfortunately, today. I understand folks have had the slides in advance. I'll talk through as I go. So first of all, from a surveillance perspective, as of Friday, we had almost 14 million cases of coronavirus around the world, almost 600,000 deaths worldwide. In Ontario, we're now approaching 40,000 cases, just almost 2,800 deaths. Locally, as of Friday, we had 642 cases, 57 deaths. Fortunately, we haven't had any deaths here since June 10th. If you go to the first chart that says cases by reported date, this is what we call an epi curve, which is a number of cases that occur each day, plotted by day. So you can see that we peaked in April in this community, and for the last 2 weeks or so, we've had an average of about 1 case per day for about 2 weeks. The next chart has a weekly incidence rates, which looks at the province in yellow and Middlesex London in green. You can see that for the first part of the epidemic, our numbers here tracked the provincial numbers almost exactly. And then in late March, the numbers of cases in Middlesex and London started to diverge, such that since then, we've had about half as many cases across the province, and now more like a third of the rate provincially. The slide entitled Federal Public Health Measures to Date, just draw your attention to a couple of things. First of all, January 22nd, federal government implemented screening measures to make sure that travelers returning from China were reporting. In February, that was expanded to all travelers. And then in March, the federal government implemented the Quarantine Measures Act, which meant that anyone coming back into Canada from abroad had to self-isolate for 14 days with federal penalties if they did not. More recently, the guidance on mask wearing changed in May to recommend mask use where physical distancing was not possible, and a number of minor changes to travel policy since then. Provincially, the file has been very active. The provincial government was able to make COVID-19 a reportable disease very quickly back in January. That was a really important measure so that we could watch the rates across the community. That makes all hospitals, physicians, or labs that diagnose a case report them to public health. It's a crucial surveillance component. Provincial state of emergency was declared in March. That's around when public schools were closed, non-essential workplaces were closed, and then gatherings over 5 people were prohibited in March. The last few months have really been a story of gradual reopening. Stage 1 in May, Stage 2 in June, and now Stage 3 reopening. Locally, we've been very active on this file, obviously, but in terms of some of the local public health measures, we identified the first local case in January. Just prior to that, we had activated our emergency response system. We call it the IMS system at the health unit. We've been supporting the provincial government and other levels of government around recommendations for closures of restaurants, bars, and clubs, for closures of playgrounds and play structures, and for universal masking in long-term care homes. That was about 2 days before the provincial government implemented universal masking in long-term care homes, and that intervention no doubt saved lives. In June, mid-June, we made the decision to strongly recommend masking in any indoor space. And that was because we were really seeing the evidence around masking grow. Previously, prior to COVID-19, evidence of masking in the general public was quite weak. So in the healthcare setting where healthcare providers have close contact with folks, the evidence for masking was stronger. But in, say, a home environment, when you're sharing a space with somebody who is positive for illness, the small studies that have been done did not show much effectiveness. We're now seeing growing evidence of that, and I'll show you a bit about that in a moment. This is our messaging from June 16th to strongly recommend face coverings. And then on July 7th, I issued a Section 22 class order under the Health Protection Promotion Act. This is a tool that allows the medical officer health to make an order to prevent the spread of infectious disease. And personal care settings and transit vehicles, including taxi and rideshare vehicles, were identified as important areas where close contact, less than 2 meters, for more than 15 minutes was a core part of the business model. So those services are where we have ordered mask use. I won't go through that in detail. Happy to take questions on it. A bit more about what we know with COVID-19. This is a droplet transmitted disease. You have seen people talking about potential airborne spread, which would be where one person on one side of the room can spread the disease all the way to someone on the other side of the room. There's not evidence that that occurs in any kind of frequency with COVID-19. The other thing we know is that close contact makes a big difference. The dose of contact, as reflected in the dose of virus, makes a difference. A small amount of virus generally doesn't have enough impact to cause infection, but a larger dose of virus is much more likely to do so. We're now on the slide that says routine precautions work. So maintaining 2 meters physical distance is very strongly grounded in evidence. Lots of research that if you're 1 meter separated from somebody, that makes a big difference, about 85% protection. And then if you're 2 meters separated, that's another 85% of the remainder. So well over 90% protective if you're 2 meters apart. Frequent hand hygiene makes a difference. And again, growing evidence that wearing a mask makes a difference. What we're looking at most closely in terms of making decisions around public health directives are 2 things. First of all, our local data, what exactly is happening in our communities. Second of all, research on the effectiveness of masks and other interventions. So we've got to know that there's a problem, and we've got to know that this intervention can solve it. We've did a rapid review of the literature. We've been watching the literature on masks in particular very closely. Did a formal rapid review about 2 weeks ago, and then last week, this study came out. So I'm now on the slide called Temporal Trends in Percentage Positivity of SARS-CoV-2. This is from a hospital in Boston, hospital system in Boston. It's actually 12 hospitals, the Massachusetts General Brigham Hospital System. And what you see in the pink component of this chart, so the black dots are basically an epi curve, the number of cases diagnosed in hospital employees each day. The size of the dot indicates how many tests were done. And then basically we're plotting the percentage positivity. So not just the count of tests, but what percentage of those tests were positive. And you can see that in the period up to the end of March, the percentage positivity was skyrocketing. We see that exponential increase that we saw around the world in cases of coronavirus around that time. At the end of March, the hospital decided to provide masks to all staff. You started to see that percentage positivity level off. And then around the end of mid-April, the hospital decided to provide masks to all patients and staff. So now everybody in the hospital is masked, both the patients and the staff. And you can see in the green period, when the effect of that change kicked in, the rates of positivity for COVID-19 in staff at the hospital are declining significantly. This is a major change. This study just came out last Wednesday. It's a major change because it's a real-life clinical application of masking both parties, and it's in the context of COVID-19. So this is not a disease like COVID-19, where most of the studying has been done in the past. This is actual COVID-19. And it's not comparing unlike populations or different jurisdictions. You know, people might want to compare what's happening in the US versus what's happening in, you know, Taiwan or Singapore or South Korea, where they've done a great job. This is one factor that has changed, and everything else in this hospital, more or less, is the same over that time. And by the way, in that green period in Massachusetts, the rates of COVID-19 were still going up. So the community rates continued to go up. Masking brought the rates down in the hospitals. That's a big addition to the literature. Some of the advantages to mandatory masking, mandating mask use substantially increases mask use. No surprise there, but that's true even when there is minimal enforcement done. Setting the expectation that people wear masks makes a big difference. And you've seen that already, I think, probably over the last weekend. We started to set that expectation. You've seen mask rates go up anecdotally in both London and Middlesex. Second, of course, this is an intervention that potentially could help reduce the spread of COVID-19. That's reason of the day why we're all here. Third, there are many people for whom seeing people wearing masks reduces their anxiety. There is a small number of people for whom wearing a mask is actually a cause of anxiety. That's somewhat, I mean, that's an important issue. There are a number of techniques that can be done to try and reduce the anxiety of those people. But for a lot of people, seeing folks in the community wearing masks makes a big difference to improve their mental well-being. And then this is something that can potentially contribute to improving economic well-being as well. As people feel more comfortable coming out into the community, feel safer going into businesses, they may be more likely to participate in the economy. There are important risks to mandating masking, and I think they deserve some time and consideration here. First of all, there's potential conflict with people who choose not to mask. And as with many such measures, that conflict sometimes disproportionately affects marginalized groups. There's also potential inequity and stigma against those who cannot afford to mask. The health unit and city staff have been working together to provide some free masks today to people related to the transit order for masking, because we know many people in the transit system are the ones that are least likely to be able to afford masks. Third, there's a risk that this sort of directive diverts attention away from physical distancing. Physical distancing and hand washing remain the most important components of COVID prevention, in addition to staying home and avoiding close contact wherever you can. They're very solidly grounded in evidence, and they're more effective than wearing a mask. And finally, masks should not be worn by those under age 2. The instruction that I put out on Friday applies to those 12 and above. Between the age of 2 and 12, it's really about the ability of the child. Is the child able to wear a mask? Can they do so safely? How does it affect the child's well-being, mental well-being? But below 2, do not wear a mask. Do not put a mask on a child below 2. There's a risk of strangulation and potentially suffocation. There are 3 legal options by which locally we could mandate masking, leaving aside for a moment potential provincial or federal orders. The first is a bylaw, which, as you know, would be enacted by council under the Municipal Act, enforced by municipal by law enforcement, and applies to a specific jurisdiction of the council. The second is a Section 22 order. This is the one that I mentioned, for example, under the Health Protection Promotion Act that I issued for taxis, buses, personal care settings. The Section 22 order is enforced by health unit staff, applies to the health unit jurisdiction, London and Middlesex County. In the case of mandatory masking in all indoor spaces, my medical opinion is that our current rate of illness does not trigger the clause in the Health Protection Promotion Act that allows a Section 22 order. For those places where I have issued the order, the risk is much higher than, say, passing somebody in a grocery store. When you're face-to-face with somebody for 15 minutes getting your nails done, or on a bus, or whatever the case may be, there's a real risk not only that one person would spread the infection to the other, but that a staff person who became infected could spread it to many others and see an outbreak. And you certainly have seen this sort of outbreak in places across Ontario and beyond. However, we're just not there at the risk level for a Section 22 order for COVID-19, all indoor spaces at this point. And then the third option is an instruction under the Emergency Management and Civil Protection Act. This is what I issued on Friday. It's issued by a public health official. The legislation is the Emergency Management and Civil Protection Act, which is the same legislation that allows the province to declare a state of emergency and create any regulations that might be required. And one of the regulations that the province has created allows public health officials to issue this sort of instruction. It's enforced potentially by public health staff, municipal, by law enforcement, and police. And so broadly enforceable, but the enforcement mandates can be complex. You can potentially need a judge's order in order to really get enforcement. And then this EMCPA sort of instruction can apply to any individual businesses or subset of businesses within the health unit jurisdiction. So that's what we've done. The limitations to the instruction approach that I've taken under the EMCPA, first of all, I mentioned the cumbersome enforcement provisions. Second, there's a risk that the instruction could be automatically revoked if there's a change to the provincial directives under the emergency regulations, or if the provincial state of emergency lapses. And we believe it actually did lapse last week for a few hours before it was renewed on Thursday. So that sort of thing is a real risk. So my recommendation to you today is to proceed with the municipal bylaw requiring people to wear masks and requiring businesses to take actions to ensure that masks are worn in all indoor public spaces. I also would recommend a communication campaign to promote the bylaw and highlight the continuing need for physical distancing. It's so important that we not think that masks are a replacement for physical distancing. They can add to the safety of physical distancing, but they're not as effective, and so we have to do both whenever we can. I've also issued these recommendations to each of the lower tier municipalities in the County of Middlesex, and Mr. Chair, happy to take any questions.
Thanks very much, Dr. Mackey. Now I'll look to both the assembled as well as those on remote to indicate. And by the way, colleagues, I show only 4 screens up right now, which is fine. I see Councillor Salih's hand is up, and that's great. So if you could use your computer, if you're able, to indicate if you're doing this remotely, that you're interested in speaking. Let me start with Councillor Lehman, please. Councillor Lehman?
Thank you. Our mics were not synced. Thank you, Worship. Dr. Mackey, first of all, thank you for coming today. It's going to be a bit of a grilling. And thank you for your service over the last 4 or 5 months. I know it's probably been a personal toll on you. Just, we have never in our lifetime experienced a pandemic, and I'm obviously in your professional career. This is new ground. So thank you very much. I have concerns with legislative authority. You mentioned there are 3 methods by which we can protect the citizens of London from kind of a governmental health board scenario. First was instruction under Emergency Management and Civil Protection Act. The section was a Section 22 class order under the Health Protection and Promotion Act. And third is a city bylaw. You have used these tools, as you mentioned. On July 18th, you issued instruction to all local businesses, and organizations to ensure masking and other public health measures are put in place. I'm reading from Middlesex London Health Unit communication. You issued the instruction under the Ontario's Emergency Management and Civil Protection Act today, on that date, requiring operators of all enclosed public spaces to implement measures requiring the public to wear face coverings at all time while on their premises. And as you also mentioned, you issued an order that comes into effect today under Section 22 regarding transit and personal care establishments. I'm still not understanding why a bylaw is needed. I feel in my role as a counselor, when health issues come to us, it's our responsibility to lean heavily on our medical professionals, and primarily those that are with under government auspices.
So Councillor Lehman, I'm sorry, you've asked a question. Why don't we allow him to respond? And then if you have another question, by all means.
Okay, so if you could explain that's discrepancy, please.
Thank you. Through Mr. Chair. You know, I think from my perspective as medical officer of health, City Council has an incredible amount of leadership in this community. And so, you know, what we really need to do between now and a second wave is make sure that people wearing masks becomes part of what is normal around here, so that when we do have higher levels of disease, we have that extra level of protection. And from my perspective, your leadership on this would really make a difference in helping us get to that place that we need to be. I think that councillors and you know, mayors are really respected in their communities, you know, chosen by the communities to lead. And so I think your voice on this issue would make a big difference.
Councillor Lehman?
Just a follow-up on your the orders that you have issued. In either of those 2 orders, have you set a time or a date when those orders will expire?
Dr. Mackey?
So at this point, we haven't set a time or date to expire. What we really are looking to is how do we get our society to a place where we can live with the level of risk, and that may take, you know, it may take several waves for people to change behaviors, or it may take a vaccine being available to really make a difference there in terms of what our society accepts as a level of risk. But right now, it's clear that our society is not at the level of accepting the risk here. You know, you may have seen research recently where across Canada, people were surveyed in terms of the level of fear that they carry related to COVID-19. And in May, June, the rate really declined from the peaks that we had of disease levels in April. But for whatever reason, that number has really climbed back up. So that people are now as afraid of COVID-19, even though there's very little in the community, as they were at the peak in April. And I think that speaks to, it speaks to the level of acceptability of the risk and the fact that we still have work to do as a society to get to the place where things feel normal again.
Councillor, you're good. Thank you very much. Councillor Salee.
Thank you, Mr. Chair, and thank you, thank you, Dr. Mackey, for service during these difficult times. I did have a couple questions. One of my first questions was, and you maybe have answered this, but because I missed the first few seconds, do you know if we have enough masks in London, with the supply chain? And I don't know if that's maybe a question to you or maybe our civic administration. And then my other question is with the past orders that you have issued, what has been, I guess, the response on the enforcement side with the application of the enforcement? Has it been our city officials by law dealing with that? Has it been the health unit trying to enforce that? And kind of, has there been a negative implication with trying to enforce that? Has there been any concerns raised? Because that's one area where I do have some concerns of how we actually enforce this and what that means to people in communities in particular that sometimes are overrepresented in enforcement. So, and I know you kind of touched on that. So if you're able to also comment a little bit further on that, that'd be helpful for my purposes. Thank you.
Dr. Mackey?
Thank you, through you, Mr. Mayor. On the first question, actually, I'm going to come back to the first question. The second question was about enforcement. And what we're really hoping to do here is use education as the primary enforcement tool. That's proven to be very effective in other places where COVID-19 masking orders have been put in place. And, I'm very aware of the risk of conflict between citizens or between enforcement authorities and the public. You've certainly seen some high-profile examples of that not going well recently. And when we made this announcement, really asked citizens around the instruction not to police other citizens. There may be a role for gently reminding folks that masking is an expectation, but beyond that, you don't know somebody's history, and it's quite possible this person has a legitimate exemption for whatever medical or human rights reason. And they may not feel comfortable telling you about it. So that's where, the limits, citizen enforcement should really not be a significant part of this. I would say the same for any enforcement authorities that are involved. There's a real risk in over-enforcing that you potentially put people at greater risk from other issues, whether it's stigma, whether it's oppression, or whether it's, there are some examples of physical harm where citizen enforcement has been involved. And I'm actually going to have to ask if the questioner, through you, Mr. Chair, could please repeat the first part of the question. Thanks.
Councillor Salee?
Yes, and the first part of the question was, do we have enough masks for every Londoner that needs one, essentially? And then the other part that was just that I wanted to ask with the second part of the question that was kind of missed was just the actually enforcing it, like what, the past orders that you've issued. Has the health unit been enforcing that? Has civic administration through our bylaw or police, have they been the ones enforcing that, or have they even been called? I'm just trying to understand those experiences, because I think what my concern is the expectation that the community might have a place where they can go to and call and say, well, there's a bylaw city, so city show up and deal with this issue. And I just want to have a little bit more understanding and transparency for the public.
Dr. Mackey?
Thank you. So on the first question of whether there are enough masks, we've defined masks, we're actually using the term face coverings primarily, very broadly. So this could include a bandana, a scarf, a t-shirt if there's nothing else available. As long as there's something covering the face to catch those droplets when they're coughed or sneezed or spoken moistly. So, essentially, you know, if you want a tailored mask off, you know, some boutique website, of course, there will be limitations there, but anyone should be able to get their hands on something to help them to get in and out of an environment safely. On the question of who enforces and how, so the Section 22 order, one of the other limitations is that it can only be enforced by local public health. The instruction order that I issued under the Emergency Management and Civil Protection Act, one of the regulations that the province has put in place has been that those emergency provisions are broadly enforceable by any provincially designated officer. So that would include any police officer, any public health officer, or any bylaw officer as well. Hopefully, so and then where our experience locally, you know, we have enforcement mandates for the health unit on a normal day that span including infectious disease, but primarily around inspections of restaurants, pools, long-term care facilities, that sort of thing. And those public health inspectors always take an education-based approach to enforcement. And we find that we're usually education is exactly what the operator needs to get up to speed and to get on board. And we find that by working with the operators and trying to support their needs as much as possible, we get a lot of positive buy-in and feedback. So that's certainly the goal that we would have with this sort of enforcement.
Councillor Sally, any other questions?
Thank you, Mr. Chair, and thank you, Dr. Mack. That was very helpful. My only question that I guess maybe goes to civic administration was the same question that I asked Dr. Mackey, because now it sounds as if our bylaw officers would have that authority, including local police service. So could someone just briefly just tell me how they will actually operationalize this for our purposes at the City of London, unless this isn't the appropriate time to ask that question, but I'll defer to you, Mr. Chair.
I think we can, we're going, just to give colleagues a sense of the process here, we are going to be, we're hearing from Dr. Mackey specifically, then we'll go into confidential session, then we will come out back into public discussion as well. So if you could save that question, Councillor, that might be the appropriate time then.
Sounds good.
If you would, please. Thank you. Councillor Squire.
Thank you very much, Mr. Chair. Thank you, Dr. Mackey. To be fair, Dr. Mackey, I want us to be on clear terms here. I will defer to you completely on all health matters. On the legal interpretation of statutes, how they apply, how enforcement, I think you've got it wrong. And I don't think you've properly characterized that, not through any intention, but inadvertently. And so I can't agree with you on the need to have a bylaw. So we'll disagree on that, and I think that's fair. One of the things that seems to be of importance to you, and this is through the chair, is this report that you saw recently from the hospital, I think I can't remember where. Now, you said that report came out last Wednesday. When did you read it? When did you actually read it and become aware of it?
Dr. Mackey?
Oh, I'm sorry.
Through you, Mr. Chair, I read that study on Thursday. It was published in the Journal of the American Medical Association online, rapid online publication.
Councillor?
So if I could just follow up on that, because I understand, and I wasn't there, that you had a health unit meeting on Thursday night. And you, at that meeting, didn't say you were going to issue any orders at all or any directions at all. I may be wrong on that. Did you read this after you had that meeting? I just need an explanation of that, because it was something people raised to me.
Before you answer that, I'm thinking of pertinence relative to this debate. If you would just want to carry on there, Councillor Squire, just.
Tell you why it's pertinent? Yeah, I just want to find out why he made this decision or order on Friday. And I also wanted to get into the issue of political influence on medical officer of health decisions.
Well, I may caution the second, but let's get an answer on the first to start.
Sure thing. Through you, Mr. Mayor, the issue of issuing this sort of instruction, it's a responsibility that as a medical officer of health I take very seriously. And it's not something that I'm going to make at a knee-jerk reaction to one study. So certainly this study was a catalyst to help move the evidence conversation along. But there have been many studies before that, and it takes time to digest and really consider the importance of this sort of work. The other thing is that it's a logistical issue where, you know, even if I may want to issue an order one day, we may not have all of the, you know, legal consultation available to properly issue that order. We may not have the, you know, staff resources available so that our staff who are answering the hotlines can answer the questions about where this applies, where it doesn't apply, etc. We need to make sure we have a communications plan to adequately get the information to those that need it. We can't turn on a dime in this sort of circumstance. So it did take time to take all of that into consideration. I'll leave the other question to your judgment, Mr. Mayor and Council.
I'm not sure what the question is yet, so Councillor Squire.
I want to ask you in a general way, because I've been curious about this, because my position has been that I shouldn't interfere with your authority to make decisions or try to influence your decisions within your area of jurisdiction. So this is the first time you and I are ever talking about this, and that to me is an appropriate course of action. How do you view political influence and elected officials talking to you about what you should do or not do? Because through the meetings we've had here, I've heard from a number of my colleagues who've said they've talked to Dr. Mackey. We've had conversations with Dr. Mackey about this issue. How does that work for you? Because I want to really be clear and satisfied that you're making decisions as a scientist and as a medical officer of health, and that you're not having back and forth negotiations with political officials. So maybe you can help me.
So if I just interpret the question with clarity, would you deem politicians speaking with you as political influence? No? Go ahead, Councillor Squire, I'll let you nail that a little.
No, I think I asked a question that's pretty clear. I just want to know what his view is on politicians who've already said publicly in meetings or otherwise that they've had discussions with you after you made orders. I just want to know what your view is of that in terms of influencing you and influencing your decision. In other words, do you say to them, look, this is my jurisdiction, stop pressuring me? Or do you just have a conversation with them?
I'll allow that question. Go ahead, Dr. Mackey.
Thank you. Through you, Mr. Mayor. So I welcome input from elected officials and through, you know, various channels for any number of other individuals who may want to have input on public health decisions. I think it's very clear that this decision is being made now based on our local data and research around the world. And probably the most important aspect that demonstrates that is that, you know, if we were going to do this based on political means, I would have done it many weeks ago. Not even done the Section 22 order that, you know, orders certain facilities and not others. These decisions are being made exactly based on the evidence in front of me. And, you know, I think another aspect is that it is important for me as a medical professional to do my best to try and understand my community. That's why I welcome those conversations with people who represent their community. The success of public health and the success of controlling coronavirus in particular is a great example. It's not primarily because of the work that I do as a medical officer of health, and my staff does incredible work, but we're only part of the picture. What is really important when you're talking about a big public health problem like this is the community doing their part, and people really have done their part. And so in the environment where you really need the community to do their part, I think it behooves me as a public health official to understand my community through the voices of the people that are elected. It doesn't change my view of the medical research or of the epidemiology, but it does help me understand the community better.
Councillor Squire?
Thank you for that somewhat complete. I think I got the gist of what you're saying, so I thank you for that. I may have some more questions.
Councillor Hillier?
Thank you very much. Dr. Mackey, I'm just curious, are there enough health inspectors to do the job without a bylaw being in place?
Dr. Mackey?
Button, here we go. Through you, Mr. Mayor, we have a pretty significant limit on our public health inspectors. Many of our professions we can draw from other agencies, and so, you know, when we're hiring public health nurses, it's often nurses from other places that come to us. When we're hiring public health inspectors, there are only 2 schools that license public health inspectors in the province. And so it's really difficult to increase our numbers rapidly. And you can imagine that public health inspectors in the current environment are under a lot of demands to help businesses open safely, and lots of complaints from different places. So, you know, we definitely have limitations on the number of public health inspectors we have. That's part of why we're going to be taking a really focused enforcement approach that is, you know, we won't be able to respond to every complaint. It'll really be places where there are hot spots where we're getting a number of complaints from one facility that we're able to take action.
Councillor Hillier.
That'll be the last from Mackey, but I will be asking staff if they expect an increase in the number of inspectors required if we pass this bylaw. Thank you.
We'll just ask to defer that to the session after the confidential session. Thank you very much. On my list, I have Councillor Van Meerbergen, Councillor Lewis, Councillor Hopkins. Councillor Van Meerbergen.
Thank you, Mayor. I think I just wanted to give an observation, at least what I've seen in my area of London in Ward 10. I noticed as we got closer to the opening of phase 3, more so even than the first 2 phases, but as we got to phase 3, there was a palpable level of concern in the community as we got closer to the date, trepidation, even fear, because it was such a widespread opening, and we're basically looking at, I believe it's around 95% of the economy. So I think what we're doing here today is very positive. I want to thank you for the presentation. Also thank you for the recommendation, because we need that leadership. I think the whole community needs it. We as an elected body need it, because to my knowledge, nobody here is a doctor or a bioscientist of any kind. So we rely on that to help with our decision-making and to help with our leadership. So thanks again. My specific question has to do with face shields. In this proposed bylaw, or the recommended bylaw, or even in the discussion, are we looking at face shields as an appropriate substitute for masks or coverings? Would that be considered as good, or perhaps is it better? And the reason I bring this up is because I've noticed in a lot of establishments, people are just wearing the face shield with no mask. Even members of the public are wearing face shields with no mask. So perhaps you could give us some information on that.
Dr. Mackey?
Thank you. Through you, Mr. Mayor. This has certainly been a common question. Unfortunately, face shields are not adequately protective. And the reason has to do with the flow of air. The air still flows out around the face shield. So if you had some kind of face shield that also had, you know, cloth underneath so that it attached to your clothing and was able to stop the passage of air, that would make a big difference. But unfortunately, most face shields don't have that option. For those who cannot, for one reason or another, wear a mask for medical reasons or whatever the reason may be, if they cannot wear a mask, face shields may be, you know, something to consider. But it really has a minimal impact on spread of a droplet spread illness compared to a true face mask.
Councillor Edmundberg?
Thank you. So just to be perfectly black and white on this, the face shield would not meet the requirement for a face covering.
Doctor?
Yeah, and maybe I'll just add to that, because there are also face masks that wouldn't meet the requirement. The face masks, you may have seen them, they've got a little exhalation valve on them. That exhalation valve allows COVID-19 to go out. So those are actually meant to protect the person who's wearing the mask from fumes or other things. They don't protect the people around them, and that's the primary reason why this order is in place. So if your face mask has an exhalation valve, you're actually not keeping the people around you safe.
Councillor?
Thank you.
Thank you. Councillor Lewis?
Thank you, Chair, and through you, I would echo again, thanks to Dr. Mackey for making the time to come and answer our questions today. I've got a few questions, so I'm gonna try and put them out in bite-sized bits so you don't have to ask. What was question 3 again? You cited the Boston study, and, but earlier in the presentation, you had referred to the fact that masks in hospital settings were already something that was accepted as a benefit, and understandably so. With the Boston study in the hospital setting, hospital settings by nature are going to be more sanitary than out in the general public. And I would guess, based on my own family's experiences with being in hospital settings, that the 2-meter distance is often very, very difficult for staff to maintain between themselves and patients as they have to conduct various caregiving measures. So what about the Boston study, in your mind, equates to a public setting when in fact it was in a healthcare setting? So I want to start with that one. I got a couple follow-ups to that.
Dr. Mackey.
No, I really appreciate the question, and the answer is that we don't have certain knowledge that this sort of regulation will affect COVID-19 rates. I need to be very transparent about that. This is not perfect research evidence. The Boston study adds, so prior to the Boston study, what we had is lab studies where you had like a coughing machine and you put something over it and you see how far the droplets would travel compared to with no mask, for example. And that showed that masks caught a lot of the droplets. Great, but it's not real world. On the other end of the spectrum, you had real world examples where large jurisdictions like states or countries implemented masking rates, and you compare them to the comparators and they do better. So that's great, but of course it could be that, you know, societies where people are more careful are more, you know, welcoming of masks by a lot. So that's it's called an ecological study, and it's got lots of limitations there as well. And then you had a bunch of studies that were done on diseases that were not COVID-19. So this study addresses all 3 of those concerns. It is the actual COVID-19. It's a specific population that on other measures wasn't changing at the time, so you can pretty much narrow it down to this causal factor. And it's real world, so it's not just theoretical, you know, in a lab. This isn't the same as, you know, if we had a study comparing 2 municipalities that were otherwise the same, one of which implemented masking, one of which didn't. I would imagine you'll see lots of data around that coming up over the next few months in Ontario, because we have really started this at different times, and you'll be able to see the impact in different places at different times. But we don't have that data yet. What we have at this point is what I believe is adequate data to recommend a bylaw and to institute an instruction to businesses. But again, the Mass General Brigham study, it's not the definitive study either. You know, the best possible study would be likely something like a randomized clusters. So the studies in the past have used households where people had an infected person living in the house. They provided masks in that setting. And they would randomize those homes to, here's a free mask, wear them all the time, or, you know, we'll just monitor you and see what the difference is, be careful. And those studies showed minimal benefit to wearing masks. So this study, where it's more about, you know, it's not a community environment, I think you're right to point that out, but it is a larger environment than a home, where you might have similar sorts of interactions as some people who have a lot of close contacts in the community. You know, the hospital study, it's not like the nurses are sharing the bathroom with the patient, for example. So that makes it different from the home environment and more similar to the community environment than the home studies would have been. But I think you're right to point out that one day we may have higher quality research that really changes our thinking around this.
Councillor Lewis.
Okay, so that's helpful, and these are sort of leading to a broader question at the end, but I want to take one more bite-sized question off the list first, and that is, you cited when you were presenting to us The 1 meter gives you 85% protection, 2 meters gives you 85% additional protection of the remaining 15%. So there's some numbers around the distancing, and that's good to have. I realize that a lot of the research is very preliminary. Is there any, even ballpark percentage that says this is the percentage of improvement that the mask gives you?
Dr. Mackey?
So the ballpark percentage that we have for masking is medical grade masking in a medical environment. And that's estimated to be similar to the 1 meter setback. But the uncertainty is higher. So there's an estimate, but it could be much, like, way off. When you get to non-medical masking, we don't have a percentage estimate. And that's in part because non-medical masking is so much less clearly defined, right? So if you are talking about bandana versus, you know, Canada flag masks, right, it could be quite different. So we don't exactly know how effective those as a bundle altogether are.
Okay, so this...
Councillor, go ahead, please.
Thank you, Chair. This leads to sort of the bigger concept question that I have for you here. Because a couple of weeks ago, you set a bar where you said if we had cases that were consistently 5 or more a day for a period of, 10 days to 2 weeks, you would consider expanding the masking order under the Section 22 order that you issued. And then we have had instructions come out on Friday that were essentially a blanket of all public spaces, but we're not requiring masks to be worn in workplaces where it's employee-only areas. And I would suggest that, for example, myself walking into Heroes Comics to pick up my books on a Thursday afternoon, I'm at a much lower risk than, say, going into a shift at General Dynamics Land Systems with 600 other employees. Yet, in the lower risk scenario, I'm going to wear a mask, and in the higher risk scenario, those employees are not going to wear a mask. So I'm trying to understand the reason behind not just going with some more targeted areas where we would have masks mandated, whether it's in a workplace setting where the public doesn't have access, or in a public setting, the blanket versus the targeted. Because to me, it seems like if we had a list that said, in these situations, masks are required, it's a lot more clear than masks everywhere, but here's a whole bunch of different places where they're not required. And to me right now, the list where they're not required still actually is longer than the list where they are. It's just people may not visually see those exemptions, whether it be in a workplace, in a home, those kind of scenarios. So I just am looking for an expansion in terms of why blanket versus targeted, and when the blanket actually has a whole lot of exemptions.
There's the question. Dr. Mackey, go ahead, please.
Through the chair, I appreciate the question. The reason why we stopped at workplaces that don't have public access is that those places are, they're monitored right now very closely by Ministry of Labor. That would be the primary authority for issuing those sorts of directives in that environment. And the employers also, and management and employees can work together to establish processes, design layouts that can actually make 2 meters possible for everybody. Or bring masking in if they can't. And so, when the employers have a very heavy responsibility to protect their employees and the ability to do so, and Ministry of Labor watching to make sure that they are, there are kind of some levels of protection in that environment. So that's why we limited there. Why go broad rather than go narrow and then expand? It's a legitimate question. The main issue is, from my perspective, is really about logistics and feasibility. When we issued the Section 22 order almost 2 weeks ago now for transit and personal care service settings, tremendous number of questions about, does this apply here, does it not apply there? And it's actually a lot simpler to make sure that it does apply in a broader range of places. I believe more protective as well, members of the public. I think there's a duty that we have and that businesses have to protect their customers in particular. There's obviously the health and safety duty to the employees, and that's really important. But I think there's a duty to protect their customers as well. And also there can be a real disincentive to doing so in a competitive environment. And, heard over and over from businesses saying that they didn't want to mandate masks if the next business over wasn't going to. But if it were mandated from elsewhere, they'd be more than happy to comply. So I think it really helps level the playing field from a business perspective as well.
Councillor Lewis.
So final question, and this one, and then I'll yield to others, although I may come back to you. And this one just came out of something that you talked about briefly in your presentation, and you mentioned early on that for some people wearing a mask could be a cause of anxiety. And then later on you mentioned the general fear level that's been measured by Canadians and how it was high, dropped, and then seems to have increased again. Have you looked at a correlation as to the fear level increasing with the result? Frankly, not of this municipality or of your health unit, but of municipalities that have instituted mandatory mask orders, in some cases without guidance and direction from their medical officers of health, and whether or not those mandatory orders may be actually playing into people feeling more afraid, particularly where councils have done this without their health units' recommendations and support.
Comments, Dr. Mackey?
No, I appreciate the question very much. And, the answer is that we don't have the data to be able to make that assessment at this point. Yeah.
Thank you. I've got Councillor Hopkins and Councillor Van Hulst. Councillor Hopkins.
Thank you. And through you, Mr. Chair, I want to thank you, Dr. Mackey. I have great respect for you and for your staff as well. I know we haven't had discussions about these recommendations, but I do and have for the past number of months when I have had questions, I've reached out to your staff and they have always been there providing me the information, and I've so much appreciated that. I am just really pleased that we have such a health unit that is very supportive of us as a council and dealing with the challenges that we are facing here in the municipality. I hope you or your staff have been receiving the many emails I have been receiving, because it is quite a conversation in the community, and really appreciate your recommendations as well. It's really important that we get the information so we can make decisions here. I want to stick to the question and the recommendation about highlighting and continuing the physical distancing. And I want to know from you if you have concerns as we introduce masks in the community, mandatory masks, if that is going to drop off, and if that is the case, or how can we communicate and how can we provide that information? Because for me, this bylaw is not so much about enforcement. It's really about the education piece and changing our behavior. And so to do that and for that to happen, that communication has to happen. So I'm interested in knowing any suggestions that you can give out to us.
Dr. Sorry, go ahead, Anne. Please finish that thought.
If you can provide any concerns or pass on information to us on how we can communicate the importance about that physical distancing, not doing a mask and forgetting the physical distancing. I think that's going to be a big challenge as we move forward.
Thank you. Dr. Mackey.
So thanks very much. So there, initially when masks were being discussed earlier in the pandemic, there was a lot of concern around whether people would be less cautious if they're wearing a mask. And that was part of why masking wasn't initially strongly recommended. There's now research on this out of out of European countries that showed that two positive things happened in that respect when masking was implemented. First of all, people are more careful around others who are wearing a mask. It's a signal to the people around them that that individual wants to be careful, and people generally respect that. And second, they looked exactly using proximity monitors at how well people who were wearing a mask were able to keep their distance or not. And it actually, on average, there's a wide variation. Some people are going to be less cautious, and that's the part that I flagged as a concern earlier. But on average, people are more cautious when they're wearing a mask. It's a reminder to them as well to be careful. So when those studies came out, that helped to be fairly reassuring. But again, we're not at the level of randomized controlled trial level data. So the observational studies do have limitations.
Thank you. Councillor, we're good? Thank you. Councillor Van Holst.
Thank you, Your Worship. And Dr. Mackey, great to have you here. I was actually looking through my emails, and Councillor Lewis and I had been discussing back in early April whether we should have you come in and answer some questions, and then decided that because you hadn't had a day off in probably almost a month, and we're very busy, that maybe it wasn't the best time. So nice to have this opportunity. So I have a number of questions. The first one is why you think the province moves us from stage 2 to stage 3, in light of the demands for masking bylaw.
Dr. Mackey?
Sorry, I'm not sure I understand the question. Why are we moving to stage 3? Or
Yes.
Okay. So why are we doing this at the same time as moving to stage 3? So
We can start with stage 3.
I'm sorry, can you say it one more time?
Yeah, actually, Councillor Van Holst, just perhaps a clear question, and maybe kind of start from the beginning on that. Not the preface, but the question itself, please.
Okay, 2 questions then.
Let's actually stay with one and see if we can get that one done first, okay? Please, if you don't mind.
So you've got close contact with the province. Why did they decide that London should be moved to stage 3?
Dr. Mackey.
Okay, so I understand. Thank you. So London was moved to stage 3 along with 23 other health unit geographies because we've been able to sustain low rates of COVID-19 across the stage 2 period.
Councillor Van Holst, second question.
Okay. Thank you. All right, then. Why then are we moving to an order to mask people rather than seeing, at least for a couple weeks, how stage 3 goes?
Dr. Mackey.
No, I appreciate the question. My sense is that as a community, we want to be more proactive rather than waiting until something happens here that then generates a response. We know there are outbreaks occurring in places across Ontario. There's one significant outbreak, for example, in Kingston. They had 0 to 1 case per week for almost 2 months, and then overnight they had 27 cases associated with one nail salon. Kingston being, in many ways a similar community. The low rates are not reassuring from the point of view of not having outbreaks here anymore. The other side of us, you're in Windsor and Essex, you're still seeing outbreaks uncovered in very large numbers in some small, subgroups like farm workers. It's a disease that is still here. We're also continuing, unfortunately, to see importations of new cases. As international travel increases, over the last few days, we've seen, probably for the last week or so, the majority of our cases have been linked to international travel. So even as we do control the spread of disease here in London and Middlesex, we're going to continue to have cases imported internationally as well. So, the other component of moving to stage 3 As one of your colleagues, Mr. Mayor, mentioned earlier today, the number of contacts that people have in stage 3 compared to stage 2 is just way, way higher. And in particular, contacts indoors. You know, when you go from the patio environment to inside a restaurant, the risk level really changes because you don't have that natural flow of air that helps to move away the virus and reduce the infectiveness. So it's a really critical time to be on top of the prevention issues that we have at hand.
Thank you. Councillor Van Holst?
All right, thank you. And sorry, I do have quite a few questions.
Next one then, please.
Taking them up for a while. Yes. So perhaps my next question, are COVID-19 viruses only present in large droplets that could be caught by a bandana, or are they smaller?
Dr. Mackey?
Yeah, so COVID-19 droplets, so they're present in a wide variety of droplets. The larger ones are the ones that are more likely to have an infective dose. So the smaller ones that can drift across a room are very much less likely to be infectious.
Councillor Van Holst?
Okay, thank you. In the study you described, was that adjusted for the changing amount of testing that took place? Because it seems to me that you said there was more cases near the end, even though in the hospital it was going down. But I think in that area, there's been much more testing, which is going to reveal the presence of the asymptomatic cases. Isn't that correct?
Dr. Mackey?
Yeah, no, it's an important question. Certainly in the US, the number of tests has increased substantially over the pandemic. But the number of tests happening in staff in that hospital really wasn't changing. So it's pretty reassuring to see the percentage positivity going down in that environment.
Councillor Van Holst?
Okay, well, I guess that's only expected. I mean, another graph you could make is sort of two bars. One is the number of people that haven't had COVID-19, and the other one is the ones who've had it and gained some immunity. So eventually it will go down, right? So maybe I could ask a question about cases versus hospitalizations versus deaths. So Dr. Mackey, I assume that eventually I'm going to encounter the COVID-19. I actually have reason to believe I might have encountered it already, because my wife was very sick at the first part of the year in January for about 6 weeks, and then later on I was going to write and say how could we find out if that's what she had, because the symptoms were similar.
And a question, please.
Anyway, can you tell us about how the cases versus hospitalizations are going in Canada? Are we finding people in our testing that aren't sick versus just people coming in because they're sick?
Dr. Mackey.
Through you, Mr. Mayor. So we certainly are seeing the case count separate from the death and the hospitalization and the ICU numbers. All four of those indicators are trending down fairly close to each other. Our cases are way off the peak, so are ICU admissions, hospitalizations, and deaths. But the percentage positivity is declining, and that's in part because there are so many tests happening in people that don't have symptoms right now.
Councillor?
Okay, well, that's a good point, and good consider. Yeah, so one thing I was wondering about, have you calculated out the cost of the masks that will be required to have everybody wear these in public, or estimated that?
I think that was answered earlier by the councillor in terms of various ways that people are getting their masks. Do you want to add anything to that, Dr. Mackey?
Through you, Mr. Chair, we've been able to source off online websites masks for about 40 cents a piece for disposable masks, in the range of $2 a mask for reusable masks. If you want something produced here in Canada, Goodwill Industries produces a great mask That's the ones that we're actually distributing free through the transit system in partnership with the city and with Goodwill. And Fanshawe actually is part of that partnership as well. They're available. Total masks costs across the whole community, we haven't calculated. We haven't done economic analysis much in terms of what a cost of COVID, of a case of COVID would be, or the masks on the other side of that equation.
I guess it all depends if we want to be as stylish as Councillor Lewis. That might be the consideration to me. Are we good, Councillor Van Holst? Can I move on?
If you don't mind, Mr. Mayor, I'll ask a couple more. I was out shopping on the weekend, saw 2 examples of people requesting greater distance. So one was from an employee, one was from a patron. And so it seems to me people are already fairly diligent, and the instructions seem to be working pretty well. When do you think you'll know just how well the community has responded to your recent order?
Dr. Mackey?
Through the chair, the impact of a public health measure takes about 2 weeks to come to the data. So there's usually about a week for that person to become sick, and then it can take several days for them to seek care and then that result to come back. So, you know, if there are other communities that are comparable, that are not implementing masking bylaws, that might be a good comparison, then we may be able to know within a couple of weeks whether this is making a difference. Certainly in terms of mask uptake, anecdotally, we're hearing that it does make a difference, both in the city and the county. But I'd be happy to hear any examples around that as well.
You said you had a second question, Councillor Van Holst?
Okay, well, Your Worship, why don't I turn this over to my colleagues and I can come back.
Thank you. On my list, I have Councillor Morgan and I have Councillor Pelosa. Councillor Morgan.
Thank you, Your Worship. And first, I want to thank Dr. Mackey for taking the time to come today and answer questions. It was a unanimous motion of council to have you come here, and we appreciate that it is time consuming and there are a lot of questions, and your time is valuable. So thank you very much for taking the time today. I have just a couple of questions. The first is going back to the goal, because I listened to you carefully over the course of the pandemic, and I understand early on our goal was to flatten the curve, to keep us under the capacity of our healthcare system. And there are some very good charts to show where we were and where we stood, and now that we've come down, are we now, with the possibility of a masking bylaw and the orders you're issuing, are we still working to keep ourselves under the capacity of the healthcare system and the ICU beds, or are we working towards some other goal until a vaccine is developed?
Dr. Mackey.
So from a public health perspective, the goals in a pandemic are always 3. The first goal is to prevent deaths. The second goal is to prevent illness and serious illness that might require hospitalization, for example. And then the third goal is to try and minimize economic disruption. And those goals are prioritized in that order, of course. So those goals have not changed from my perspective. There certainly has been a lot of conversation through the provincial governments and the healthcare system about trying to avoid overwhelm to the healthcare system. And I think we're well past that point. We were not near that point even at the peak of the pandemic, in part because of good public health measures that were taken at the provincial level and elsewhere, and in part because the healthcare system really ramped up capacity to try and make sure that it was available. So fortunately, we haven't had that healthcare systems being outstripped as other countries have.
Thank you. Councillor Morgan.
Yes, my second question is related to some numbers that you gave. I can't remember if it was a radio interview or not, but I'm very interested in them because you had some questions about the differences between, you know, issuing an order under the HPPA, the instructions under the emergency management regulations, and of course a bylaw. And so at one point you had described the conditions under which you would issue an order under the HPPA. I can't remember what it was, but it was something like so many cases per week for a sustained period of time. Do you have a specific number in mind, or would you mind sharing that again with us? Because I want to understand under which, you know, that would trigger the consideration of an order for you.
Dr. Mackey.
Thanks for the question through you, Mr. Chair. So this is really where there's a lot of judgment that is applied. And so I can give you a number, but that may change based on evidence or what else we know about our community between now and that occurring. But if we had rates that were closer to our pandemic peak level, 5 to 10 cases per day for a prolonged period, that's where we would say we're back in wave 2. And whatever other measures we have in place aren't working, we need to take more measures. And we're still not there, but I'm still willing to issue a Section 22 order if our local epidemiology justifies it.
Councillor Morgan.
Thank you. So I appreciate that answer too. So, because I'm trying to understand the difference between, issuing an HPPA order or the combination of the instructions you've issued plus a municipal bylaw and where they can compare to each other. Because, obviously, the differences between the two. You have full control over the HPPA order, and that expires when the conditions change, and you feel like you can withdraw the order, whereas the other two are tied to either emergency orders by the provincial government or political decisions of the municipal council. And so I'm just trying to understand when we would make the shift between one and the other, right? Because I understand your recommendations today, but I also know that there's many people who feel like an HPPA is very easy. You have full control over it. There isn't the political discussions or debates or the things that we're going to have here. It's very clear. It applies to the region. It's very simple. So I don't know if you can, I don't even know if you can make a comparison between the two, but I just wonder, like, at what point we shift between those two strategies is what I'm trying to understand more clearly.
Dr. Mackey.
Yeah, through you, Mr. Mayor. So HPPA is really at a level of disease where there's a demonstrable risk in the community, and there's an effective intervention that we know will curb that risk. I don't think we're there from the level of disease perspective. That's certainly the biggest driver that would take me towards a Section 22 order. But I also don't think that fully captures the opportunity for leadership here that council has. This council is well regarded in the community as being composed of leaders that represent their population. And from my perspective, having that support would really go a long way to moving this issue forward.
Councillor?
Yes, on that topic, I don't know if people can see at home because the cameras don't switch around, but you talked about demonstrating leadership. I'll say every member of council in the chambers today is wearing a mask because we're following the provisions of the guidance that has been given. And I do believe in setting, leadership examples, and I think that that's what we're trying to do today. But we're also trying to grapple with a challenge between supporting and reinforcing the medical decisions that you're making with either bylaw support or public education support, with the challenge of the way that we're supposed to make democratically elected decisions in consultation with our constituents and judging their concerns. And that pendulum between a health decision and a political decision is challenging for me to navigate. And I think a lot of the questions you're getting is us trying to figure out where we are on that spectrum and how we make these sorts of decisions. So I know I'm supposed to be in questions, so I should say this more for debate, but I appreciate your time.
Thank you. Councillor Pelosa.
Thank you, Your Worship, and thank you, Dr. Mackey, for coming today, and for your staff at the Assessment Insiders. They were great. I was there myself, needed to have a test done, and they were phenomenal from start to finish. So thank you for that. Parents with children, and you go in and your kids are at ease, which is perfect. I had lots of conversations and feedback coming from residents and verbal conversations as well, with concerns on both sides, oppression of rights versus the desire for the public good. Some concerns from residents recognizing that we're in phase 3 and not all our area resident surrounding communities are. And we do have regional tourism and summer tourism happening with people coming from across the province. And they have health concerns of their own that make them either vulnerable or that they can't wear a mask. The health unit had a great ad, in my opinion, on the radio about things that would exempt you from having to wear a mask. It's on your website, but recognizing not everyone goes to those places. If you could just publicly state what would allow you to be exempt, and if you're mandated to prove that you have an exemption.
Dr. Mackey.
Thank you. Through the chair. So age under 12 is an exemption. Any medical reason why wearing a mask would cause medical harm, anyone who can't put on a mask or take off a mask safely by themselves, anyone that would have a disability that might make it difficult to wear a mask, but also any other protected human rights under the Ontario Charter of Human Rights. These are the things that would, at the individual level, exempt the individual from having to wear a mask. And I think the second part of your question was about needing any proof, and I've been clear in the instruction provided and in working with city staff that proof should not be required. This, among other issues, it gets into the realm of potentially exposing people's medical information against their will, and so that's a real potential harm.
Councillor?
Thank you for that. As certainly education is a primary enforcement tool, and you can't beat knowledge of why you're doing something. My second question, just so many have been touched on today, I don't need to rehatch anything, but some parents have reached out and some are really hopeful for the fall and school reopenings, and they just want to make sure that you're working with the school boards of how that might look from a public health point of view.
Dr. Mackey?
Yes, through you, Mr. Mayor, definitely working with all of the school boards in this area. This is another situation where our society will have judgment calls to make. There's no way to eliminate the risk in a school environment on the one hand. On the other hand, students, children in general, and the younger, the better in terms of their performance with COVID. Children seem less likely to acquire the disease, less likely to become particularly sick if they do acquire it, and less likely to pass it on to others. So, I certainly believe that school opening in the fall is the right thing to do, and of course there's work to do to make that as safe as possible.
Councillor, thank you. Any other comments or questions for Dr. Mackey? Councillor Kayabaga.
Thank you, Mr. Chair. Through you, I'd like to first thank Dr. Mackey for being here today and answering the many questions that are arising from this committee. I had a question around, in terms of masking in the kitchen for businesses, what are some of the measures that we're looking to take on that?
Dr. Mackey?
Yes, so through you, Mr. Mayor, so I think we're talking about kitchens and restaurants.
Yeah.
Yeah, so essentially there's strong guidance that people should be wearing masks in that environment, especially if they're so in terms of the instruction that I've issued, if they're in the same airspace as the general public, then the public health instruction would apply, so they must be masked. If they're closed off in the back of a kitchen and there's no shared airspace, the bylaw wouldn't necessarily apply, but again, there's strong recommendations through the provincial directives for reopening that those sorts of employees do mask. Part of the issue is, it's very uncommon that somebody would acquire COVID through the food, but you do have staff that are often working in close contact with each other in those environments, and it can be difficult to keep 2 meters apart there.
Councillor Kayabaga?
Thank you. That's all for now in terms of questions. I'll make some other comments later.
Thank you. Any other comments or questions from those we've not heard from yet? Deputy Mayor Helmer.
Thanks very much. Through the chair to Dr. Mackey, I wonder if you could just give us a sense of how other health unit jurisdictions have been approaching the issue of masking. I know that there's these different ways of either an instruction or a Section 22 order or a municipal bylaw. And I wonder if you could give us a bit of an overview. I'm not expecting you to cover every health unit jurisdiction, but what some of the other health unit jurisdictions have done.
Dr. Mackey?
Yes, through you, Mr. Chair. Essentially, communities that are larger than London already have this in place, and that's in part because their rates of illness have been higher than ours, often 2 to 3 times as high. In larger jurisdictions, Ottawa, Toronto, Peel, York, Durham, Hamilton, they've all gone the route of the bylaw with the support of the medical officer of health there. Beyond that, you've seen a variation where there have been a few section orders issued, and there are now, I think, 3 health units that have the instruction in place, but certainly the larger municipalities have gone the bylaw route.
Deputy Mayor?
Thank you. I'm going to just make one comment, which is I think sometimes this is perhaps lost in the coverage around COVID-19, but I wanted to commend Dr. Mackey and the whole community for managing to get through the first part of the pandemic with a relatively low prevalence of disease. You know, we're around 127 cases per 100,000 people. And as far as larger urban centers go in the province of Ontario, that is the best of anywhere. And I think that is an important thing. You know, I know that there's some element of randomness to that. You know, it's not as though it's all public health interventions, but it doesn't take very long to look around at other jurisdictions and how they're faring. Here we are, you know, 2 hours down the road to the west, the incidence of disease is significantly higher. Across the border, where they have a different public health system altogether, it is significantly higher. In Wayne County, it's 1,359 cases per 100,000 people. 1,359 cases in Wayne County. That is the county that contains Detroit. In Toronto, it's similarly very high, as you see in Windsor, over 450 cases per 100,000 people. And I think we are very fortunate in London to have had the kind of burden of illness that we have so far. And as Dr. Mackey was careful to point out himself, it's not as though it's public health leadership that is the result, you know, causing that. It's the community response and the overall reaction at all levels of government and businesses and individuals, what they're doing. But I did want to point that out, that we have managed to get through so far with relatively low a burden of illness relative to the rest of Ontario, especially the urban centers in Ontario. And I want to congratulate Dr. Mackey on that.
Thank you. Councillor Squire.
Thank you very much.
Sorry, I apologize. I always go through the first people first.
Oh, I'm sorry.
And Councillor Cassidy just snuck in.
I'm sorry.
If you don't mind, I'm going to throw you off the agenda for a second, bring you back, Councillor Squire. Councillor Cassidy, please go ahead.
Sorry, thank you. Add my thanks to Dr. Mackey for appearing here and also for leadership of Dr. Mackey, Dr. Alex Summers, who's the Associate Medical Officer of Health and has been also key in leading the COVID response, and to the entire health unit staff. I know most of them have been working 24/7. I know most of them, I know Councillor Lewis mentioned about vacations. I think it was Councillor Van Holst, vacations being frozen. They were frozen for many, many months for everybody at the health unit. So it's been a very, trying time. A lot of people putting all their effort in, and as Deputy Mayor Helmer mentioned, we see the results, and the result is absolutely from the community and the response from the community, but being led by our public health unit, which has done a phenomenal job. There was a comment made about immunity, having immunity if you've had the illness, if you've had COVID-19. I wonder, through you, Mr. Mayor, to Dr. Mackey, if he could let us know, is there immunity expected for people who have been ill with COVID-19? And if there is immunity, is it permanent immunity? Is it long lasting? Is it short lived? I wonder if you could expand on that, Dr. Mackey.
Is that research available, Dr. Mackey? Please go ahead.
Well, through you, Mr. Mayor, insofar as the answer is we don't know yet, then yes, But there is data around antibodies for people that become infected. And it's about a month after the infection that people develop the highest levels of antibodies, but only about 50% of people do. So half of people who get infected don't develop antibodies. Now, we know more about the immune system than we did 10 years ago, so we know that that's not all there is to immunity, and there may be some cellular level immunity that's much harder to measure, but it's not encouraging from the point of view of our main defense against this sort of virus being antibodies.
Councillor?
Nope, that's good. Thank you.
Thanks very much. Councillor Squire?
Thank you very much, Mr. Chair, and through you. Dr. Mackey, I promised someone I would ask about recreational activities. They wanted me specifically to ask you about this. And these are the people who run places like the BMO Center, larger recreational facilities. You can imagine a place like the BMO Center has all kinds of kids running around inside playing soccer, hundreds and hundreds of kids. Would they be running around playing soccer with masks, or how would that work when we get to the stage of doing that? Because as you can appreciate, there is some genuine concern about that, and it's not something that's talked about specifically by
Dr. Mackey.
Thanks through you, Mr. Mayor. The instruction that I've put in place has an exemption for people where the activity prohibits or wearing a mask. So that would include physical activity. It would include, if you're getting a shave or if you're eating food while you're eating, then the mask is not required.
Councillor, good? All right, good. Councillor Van Holst, were you trying to come back in because your light's still on, or you can?
Yes, I raised my hand again. Thank you.
Okay, good. I have you, and then I have Councillor Hopkins who wants to come back in as well. Go ahead, Councillor Van Holst.
Okay, wonderful. Thank you. Perhaps we can just talk a little bit about some of the drawbacks of wearing masks. So somebody wrote us and said they were in a mall and then found it very hard to breathe and had to run out and in order to be able to take their mask off. I've heard other problems like this, listening to individuals who deal with PPE in industrial settings and are consultants for that kind of thing. Can you describe the meaning of hypoxia to us and how that relates to mask wearing and why some people should be concerned?
Dr. Mackey.
Certainly, through you, Mr. Mayor. The hypoxia is inadequate oxygen getting to the vital organs. Wearing a mask for the vast majority of people wouldn't have a role there. For people who are very, very respiratory compromised, whether because of, surgery or chronic smoking or that sort of thing, you may reach a level where the mask would make a difference. But generally, we're talking about people who, require oxygen for their activities of daily living. So it wouldn't be an issue for most people. There is a phenomenon of mask-related anxiety, though, and that's somewhat more common, where people feel like they can't breathe when they're wearing a mask, and that's an important side effect. But there are also strategies to support people that have that sort of anxiety. And if an individual has that, they should definitely reach out to their healthcare provider to help identify those strategies that work for them.
Any other questions, Councillor?
Oh, yes. Thank you, Your Worship. I'll say, first of all, I'm much happier having you make the orders than have council do it. And something you said that was very significant to me was that we're not at a point where you would make a Section 22 order. And I kind of relate this to the defense condition system they have in the United States, or the DEFCON. They have the situation, each type of situation has a different number of actions that would be taken. And so I'm interested then if we have a bylaw that says everybody has to wear masks at this point with only 13 cases, then what happens next?
Are we at DEFCON 1, 2, or 3, Dr. Mackey?
So I think the question is much appreciated from the point of view of having a proportional response to the level of risk. If I would say we're at DEFCON, 2 or so. To be honest, I don't fully understand the system, but I know we're beyond 1. The reality, though, if we reach those higher levels of risk, we would be looking at some of those large-scale public health measures like closures again. And, a bylaw around masking could really help prevent us getting to those higher levels.
Councillor?
Okay, thank you. Just a question about the idea and of herd immunity. Like generally that's, we understand that that's when we don't have to worry about a particular disease. And can you talk a little bit about that, Dr. Mackey? At what point will we be fine in terms of COVID because of that? And how do we get there?
If this has to do with the mask policy, absolutely. Go ahead, Dr. Mackey, please.
Sure. Herd immunity is where, enough people either have been vaccinated against an illness or have been infected against an illness so that they're immune to it. We don't know for sure if being infected confers that sort of immunity. So I think we're pretty far off from achieving herd immunity in this.
Okay, well, a follow-up to that then, if I can, through you, Your Worship.
Go ahead.
We seem to be looking for a vaccine, but of course, a vaccine just introduces a dead version of the same virus. It basically does the same thing as getting it, except it's less virulent. But if that's not going to produce a herd immunity or even immunity at all, then looking for a vaccine really isn't a legitimate goal. So what can be, well, I'll ask you to comment on that and then ask you what other things people can do.
Okay, I'm going to have Dr. Mackey answer the question, but folks, what we're trying to do is work towards a mask strategy to the extent that either we as council are prepared to consider that based on the advice of Dr. Mackey. And I just think we're going into some different directions, but I'll let you answer that question, Dr. Mackey. But colleagues, we've been pretty flexible with the number of the questions because it's part of our learning curve and we know that. Dr. Mackey, go ahead, please.
Sure. Through you, Mr. Mayor. I'm not an immunologist, but I understand there are a number of different strategies that are being used to develop different types of vaccines that potentially could even be more effective than the standard, which is using the killed version of the virus. There are also strategies to accelerate the testing of vaccinations for COVID-19 that are being explored at an ethical level, really, where you'd potentially challenge people who have been vaccinated with the actual virus to look at their immune reaction. Lots of issues to sort out there, but you're seeing progress on this vaccine happening faster than I think probably any vaccine in history with the amount of attention it's had.
Any other questions, Councillor?
Okay, thank you. Although I still, in response to that, Dr. Mackey, wonder, based on your comment that, and Councillor Cassidy's comment that there might not be immunity, the value of that effort may not pan out into something useful for us. I think I'm just looking through my questions here.
Councillor, are you ready to ask a question? If not, I'll move on.
Right. Okay, you're welcome to move on, Mr. Mayor.
Thank you very much. That's very thoughtful. Councillor Hopkins, please.
Yeah, thank you, Mr. Chair, for allowing me to ask another question. I was going to leave this to staff, but I think Dr. Mackey, if you allow me to ask you this question, because I too have been contacted by a number of fitness studios, yoga studios, for instance, and there was a lot of panic at first, and it was good to see that establishments that deal with engaging athletic or or fitness activity are exempt from wearing masks. I could not imagine doing a yoga class wearing a mask. But, and I understand it's mentioned in our bylaw as well. My question, though, is a lot of these smaller businesses have had to change the way they do their business with the making sure there's 6 feet distancing, that you only arrive by appointment, and your sort of classes are now down to 2 instead of 8 a day. And all those changes are, I know a lot of places are dealing with the changes. So now that they are exempt when you are physically doing physical activity, you don't have to wear a mask. But when you enter the studio or the building and you go from the front door into the area that has been assigned for you to work in or work out, are masks required?
Dr. Mackey.
Yes, so the masking would be required except when doing those activities. So, you know, for example, if you're going for dinner, you wear a mask in, you sit down, your food comes, you take the mask off, eat the food, put it back on. So, so yes, it's required in those facilities when not engaged in those activities.
Councillor Hopkins?
To that.
Thanks very much. Colleagues, we have, under the thoughtful allocation of time from Dr. Mackey, he's indicated that to me earlier that he'd be prepared after our confidential session to hang around a little bit and respond to some questions, which I'm not sure if that still works for you, Dr. Mackey. I hope it does. I'm getting a nod. So, colleagues, we have under 4.1, we have three items, Dr. Mackey's presentation and presentations in writing from M. Sheehan and D. Pietsch. I'd look for a motion to receive. Councillor Hopkins, seconded by Councillor Pelosa. Any other comments or questions, colleagues? Colleagues, we're going to call this vote to receive the information. Councillor Van Holst.
Yes.
Councillor Lewis.
Yes.
Councillor Solie.
Yes.
Deputy Mayor Helmer.
Yes.
Councillor Cassidy.
Yes.
Councillor Squire.
Yes.
Councillor Morgan.
Yes.
Councillor Lehman.
Yes.
Councillor Hopkins.
Yes.
Councillor Van Meerbergen.
Yes.
Councillor Pelosa.
Yes.
Councillor Kaibaga.
Yes.
Councillor Hilliard.
Yes.
And I vote yes.
Recused?
And with one recused. Thank you, Councillor Turner. Didn't
Close.
mean to ignore you.
Closing the vote, the motion's passed 14-0 with 1 recuse.
Colleagues, we have no deferred matters, and before I move us into confidential session, I'm going to give us I know we take about 3 or 4 minutes to move this to confidential, but I'm going to ask that we have a 5-minute refreshment pause. That's what we call that. It's a very polite term. So we'll have 5 minutes. We'll ask you to come right back in, please. I'll look for a motion to move into confidential session. Councillor Cassidy, seconded by Councillor Lewis. Just bear with us, colleagues, as we go to the voice vote. Councillor Van Holst.
Yes.
Councillor Lewis.
Yes.
Councillor Solie.
Yes.
Deputy Mayor Helmer.
Yes.
Councillor Cassidy.
Yes.
Councillor Squire.
Yes.
Councillor Morgan.
Yes.
Councillor Lehman.
Yes.
Councillor Hopkins.
Yes.
Councillor Van Meerbergen.
Yes.
Councillor Turner.
Recused?
Councillor See, I knew I had to include you, sir, at that. Councillor Pelosi.
Yes.
Councillor Kayamaga.
Yes.
Councillor Hilliard.
Yes.
And I vote yes.
Closing the vote, the motion's passed 14-0 with one recuse, and that is to go into closed session for the reason as published on the public agenda.
So we will go into public session about 5 minutes, or confidential session 5 minutes, and from there, we'll go back into public, just for the benefit of our public who's watching. We'll take our pause as we speak. Thank you. Colleagues, I'd like to move us now back into public session. We have received in public session earlier a report from Dr. Mackey. Thank you again, Dr. Mackey, who has been gracious enough to stay for this component. We then went into confidential session, and now we are dealing with the matter at hand, which has to do specifically around the area of the prospective bylaw. And I'd like to first, though, ask the Deputy Mayor to report out of confidential session.
Thank you. I'm happy to report through the chair progress on the item we went in closed session to discuss.
Thanks very much. Councillor Lewis. So let's see if we can get this started. And you know what? And I just say this, colleagues, not for brevity and not for the purpose of limiting people's discussion, but I know that we spend an awful lot of time in preamble, and sometimes preamble is really important, sometimes less so. So in the spirit of that, I am not trying to limit debate or discussion, but I've had several people send me notes and all, and just as, not as a limitation or not even as a cautionary, but let's I think if we could be helpful in being tight with our words, comments, questions, and staying focused on hand. So if we start a list, I actually have now Councillor Lewis to start us off, please, followed by Councillor Morgan and Councillor Salee.
Well, thank you, Your Worship. That was quite the preamble to keeping our comments brief.
Sorry.
This is arising, a question for Dr. Mackey, who I appreciate stayed around to answer any further questions that might arise. Dr. Mackey, the communication that the health unit sent out on Friday that included language on sign postings at businesses is not the same as the language that's included in our draft bylaw here. And I understand that you did provide some recommendation on the draft bylaw. I think it would be honestly confusing to the public to have two different signs posted that don't read the same. Is there a reason for the difference? And would you actually recommend aligning the language so that it's the same for a single sign?
Dr. Mackey, thoughts?
Thank you. Through you, Mr. Mayor. I'm not sure which version you're looking at. We tried to make them as similar as possible. Just simplified a little bit so that we weren't requiring, call the health unit, and the city was requiring call the city. But other than that, they should have been aligned. If we missed something, or it may have changed since the last version I saw. We're happy to align and adjust to fit the city's.
Councillor Lewis?
If that's the direction the city chooses to go.
Excuse me, I'm sorry to interrupt you. Councillor Lewis.
Okay, thank you for that. Yes, I'm looking at the July 17th communication from the health unit and then the SPPC report that we received on the 18th. So there are two different dates there. I just want to make sure that if we do in fact go ahead, that we're using the appropriate language.
Am I getting an understanding there to be an undertaking to be consistent, Dr. Mackey?
Yes, through you, Mr. Mayor, we're happy to work with city staff to make sure that they're consistent.
Thank you, Councillor Lewis. Anything else for you for now?
Yes, one other matter, and I'll be brief. Colleagues, these are, in most circumstances, I would not consider this, but I'm going to put a motion on the floor now because I think these are exceptional circumstances, and I think we need to be as clear with the public as possible. So I'm going to move that the solicitor-client privilege of counsel for the confidential staff report dated July 20th with respect to the additional legislative measures to reduce the risk of further COVID-19 infections in the City of London be waived so that we can release this report to the public.
Unprecedented at this point, but is there a seconder? I have Councillor Squires seconding. Any comments or questions that would aid the discussion? If not, we can vote sooner than later as to whether or not to make this public or not. That might have been a double negative. Comments or questions, colleagues? Councillor Pelosa.
Thank you, Your Worship. My question would perhaps be legal in nature again, either for a closed session or open, asking if we make the report public, what liability that could potentially open us up to as a corporation.
Just bear with me. I may take some advice from the clerk on this. Equally wise is our solicitor, so perhaps we could get some initial thoughts from the city solicitor. And if we have to go into confidential session again, we will deal with that, but hopefully we do not. Learned counselors, can you give us some wisdom, either Ms. Anderson or Mr. Card? Mr. Card, looks like you're up.
Your Worship, one of the reasons for having these reports go in camera is to ensure that the discussion is uninhibited by those types of concerns, liability concerns. Generally speaking, councils can make policy decisions without fear of liability for economic reasons, for public health reasons, or whatever, and the courts do not generally attach liability to those types of decisions. I am not personally in favor of reports being made public because they do expose the members to an additional risk that is completely unnecessary, in my opinion.
Councillor Pelosa, back to you. Okay, we're done there. Thank you. Councillor Squire. And by the way, this is, I still have Councillor Morgan and Councillor Sally, but this is to do with the issue at hand. So Councillor Squire, please.
A couple of things. First of all, if you asked me, wearing my hat as a lawyer, whether I would ever recommend that a report in private session be released, my answer would always be no. No, don't release that. The lawyers will say that, and they're saying it, and I respect them for saying it. However, we have turned this is no longer a legal issue, and in my respectful submission, we have turned this entire issue into a political issue. We've been turned it into a public issue to the extent that now I understand the legal opinion from the City of Toronto is now circulating online. So that people out in the public are going to be reading, I assume, the legal opinion of the City of Toronto, which I haven't reviewed because I live in the City of London. So these reports are now out there in the public sphere. And frankly, on an issue like this that's created so much division, unfortunately, in our city in the last week, we need to get everything out public. The obligation to keep things in private session is not mandatory. It's always important to remember that. We choose to go in camera and keep things in camera where there's liability at stake. And I don't think that is the case in this particular case. I think the public has an equal right to know why we would be considering passing a bylaw, because that's largely, from my point of view, a legalistic decision. So I want to be quite clear that I think in this particular case, the best thing to do is to get this report out into the public so the public who is so interested has full disclosure.
So I'd like to build quickly on Councillor Squire's comment that he has made with regard to any other report that is out there, because I think we would all be interested in knowing that. He's indicated it's gone from legal to political. Let's always hope it's an issue around health too. I mean, that's the whole point of this process. I'd like to ask our legal counsel, or if anyone else is aware with certainty, that just to build on Councillor Squire's point, that any other municipalities' legal advice has gone public. Can anyone comment on that? Perhaps I could ask our legal advisors if you can comment on that, our legal counsel. Do you happen to know that, Mr. Card or Ms. Anderson?
I do not, Your Worship. I have been on vacation until today. We do have an association of municipal lawyers in Ontario where we do exchange views. So I am privy to the views of other lawyers. But generally speaking, those opinions are not made public either by any of us or by the councils of those municipalities. And, you know, again, that's a convention. Councillor Squire has delved into it. I won't talk about it further.
Would Ms. Anderson know? If she doesn't, that's fine, but I'd like to get a sense. And by the way, apologies, Mr. Card, you were away, and I should never have taken you back. But having said that, you are here, and Ms. Anderson is, just if she happens to know, it would be helpful. If not, we'll move on.
Thank you, Your Worship. I'm aware only of the same confidential information passed between lawyers that Mr. Card spoke of.
So is anyone aware with certainty? Councillor Lewis?
I have the document right on the screen in front of me, toronto.ca/legal documents, legal docs, sorry. So it's there. Folks are free to see it. It's right there through the Toronto website.
Again, to be clear, we weren't challenging Councillor Squire, but I think it was important to have a point of reference. All right? Any other, Deputy Mayor Helmer, thoughts, comments on this issue?
Thank you. I'd like to go back into closed session. Questions for the solicitor in closed session.
Do you have a seconder? Seconded by Councillor Cassidy. Comments, questions? If not, we will call the question. Just bear with us, colleagues. All right, folks. Councillor Van Holst. Councillor Van Holst.
Yes.
Councillor Lewis.
Yes.
Councillor Salee.
Yes.
Deputy Mayor Helmer.
Yes.
Councillor Cassidy.
Yes.
Councillor Squire.
Yes.
Councillor Morgan.
Yes.
Councillor Lehman.
Yes.
Councillor Hopkins.
Yes.
Councillor Van Meerbergen.
Yes.
Councillor Pelosa.
Yes.
Councillor Kayabaga. Councillor Kayabaga. Please turn on your audio, please. Thanks.
Yes.
Councillor Hillier.
Yes.
I vote yes. Councillor Turner. Is recused.
Closing the vote, the motion's passed 14-0.
Okay, colleagues, we will, and for the benefit of the public, we're going to be going into public session, or pardon me, confidential session, and when that is complete, we will come back in through this process as well. Thank you. Thanks very much, colleagues, and to the viewing public. We have now back in public session, and I'd like to turn it over to the Deputy Mayor to report out of confidential session.
Report progress on the matter. We went in closed session to discuss and indicate that the city solicitor has been directed to bring forward a public report on this matter.
Thanks very much. I'm just going to now reference over then to Councillor Lewis, who had a motion originally party way to confidential session. Councillor Lewis.
Yeah, thank you, Your Worship. Given that staff has been directed to prepare a public report coming out of confidential session, I'll withdraw my motion at this time.
So noted. Thanks very much. I have on our speakers list now, Councillor Morgan, followed by Councillor Salee.
Thank you, Worship, and I'll apologize now because you said no long preambles, but this is probably going to be not short because I want to contextualize where my thinking is on this for colleagues, and I want to appreciate that the last time we met, we found a compromise approach to this by having Dr. Mackey come forward that had the unanimous support of council, and I'm hopeful we can find a path forward on this as well that satisfies some of the questions and challenges that colleagues have on this. And with that, I want to go back to what I mentioned in my questions to Dr. Mackey about the challenge of an important health issue and health decision all the way to a political decision in which we are a political body, and this is an elected government. And we have the challenges in elected government of making decisions based on the traditional way we do, and that's, you know, we consult our constituents, we weigh our opinions, and we decide. On this, like many of my colleagues have mentioned, I have my preference is to have a lot of discretion, if not complete discretion, to Dr. Mackey and the team at the London Middlesex London Health Unit in handling this and issuing the proper orders and that. And you heard Dr. Mackey say today that there is a role for the municipality to play in a mask order. The direction we gave to our staff, and let's be clear about this, our staff have brought back this report in this bylaw because we directed them to do so. We asked them to bring back a bylaw. We asked them to consult with the medical officer of health, and what we have before us is a combination of those events. And in that discussion with Dr. Mackey that we had, he also talked about the council being supportive in enforcement, the council being supportive in education, and he talked a little bit about leadership as well. But for me, this is a medical concern and a medical issue, and I'm 100% supportive of the municipality supporting the medical officer of health in the instructions and the orders that he has issued to date. With that, the one challenge that I think some people will have with the bylaw comes at the very end of the draft bylaw in section 25, which basically makes the force and effective date end on December 31st, 2020, which does not align with any sort of medical decision or provision. And I would be much more comfortable with this being aligned with some of the directions that have already been given by Dr. Mackey. And so the section 25 could be amended to add, or until such time as the regulation is revoked, referencing the regulation under which the current instructions are given under, which is, I believe, O Regulation 36420, outlining Phase 3. Phase 3 is about safe reopening. It is the provisions of the province. It has been extended multiple times, and it will continue to be in place as long as our medical advisors at the provincial level allow that. And if it ends and we have a problem in the City of London, certainly the medical officer of health has the issue under HPPA to issue an order, and we could always reconvene as a council under his guidance. But I think that our path here is to align our bylaw with that provision of the regulations and move forward in supporting the directions that have already been given. And so I would be happy to move the direction with that addition if there was support by my colleagues, but I believe that that is a path where there's probably some large common ground on this, and I would love to hear my colleagues' thoughts.
Councillor Lewis?
And just indicating that I'll second Councillor Morgan's motion if he wants to put it on the floor now for discussion.
Comments or questions, colleagues? Clarification from Councillor Squire.
I just want to understand what that wording will be that's being proposed. Is it the earlier of the two dates, or is it the, I need to know that. So I assume what's being done is that it'll be either December 31st or earlier if the state of emergency ends, but in any event, we will be reviewing it at the end of the year. Is that right?
Councillor Morgan, that's certainly my understanding of
Yes.
where that was going to go.
Yes, that's the intent.
But it does beg the question on your point of clarification, Councillor Squire, and that is that if this situation were such that it went beyond December 31 as well, that's the other consideration. So is it just as easy, or are you suggesting it just meshes with, as opposed to the earlier or later of, so that you don't get into the wordsmithing? We'll ask another learned counsel.
Just to clarify, that was my concern, that it would not be an absolute intermeshing. If we made it the earlier of those two dates, the date that this expires could in fact be earlier than the emergency legislation. So then we'd have Dr. Mackey's order standing and we would not have a bylaw. So I don't know where we're going in that regard.
Well, let's ask the mover.
Yes, so the intent of this would be, it would align with the regulations. If the regulations ended, so would the ability to enforce our bylaw. If the regulations were extended beyond December 31st, 2020, council would have to consider extending our bylaw to ensure that it does not terminate on that date. Obviously, that's not really the scenario I think anybody's hoping for, but that's certainly a possibility.
Councillor Lewis?
Thank you, Your Worship, and through you to our staff. I wonder if our city solicitor could indicate to us if in fact the December 31st date appeared to be approaching sooner than the end of the stage 3 provincial orders. What would be the approximate timeline where staff would bring this back for our review? Obviously, if it's December 31st that the bylaw expires, we would have to consider it before we had our Christmas break, whether we wanted to extend it or not. So I'm just looking to staff for a little bit of direction there.
It could be clerk or the council. Do we want to have our, I have Deputy Mayor Helmer on the list here, but Mr. Card, do you want to respond to that?
Yes, Your Worship. The regulation 36420 could be repealed by the province without notice. I think that's something that Ms. Anderson had mentioned earlier. We don't have any control really over when the province decides that that regulation terminates. But our intention would be to advise you if that happens and come forward with a recommendation that the bylaw either be renewed or repealed. And if that takes place before December 31st, you would have the opportunity to align with the provincial thinking. If we get to the end of the year and there's still a need for the bylaw, then we'd be coming back to you with a recommendation that the bylaw be continued for some additional period, depending on prevailing circumstances at that point.
Councillor Lewis, you're good?
Just a very quick follow-up on that then. And understanding that provincial prerogative is the provincial prerogative, but they've been very clear so far about announcing we're moving into stage 2, we're moving into stage 3, and giving, well, frankly, I've heard businesses say they haven't given them enough notice, but that's up to them to lobby their MPPs on. But they have given us notice, so that would give staff the opportunity. Then what I'm hearing is to come forward with, if the orders are being lifted sooner, staff could then respond and say, okay, the next cycle we have to deal with this because the province is changing the state of the emergency or the phase that we're in.
Thank you. I should have recognized Councillor Salee. I'm not sure if he still had something he wanted to say on this specific speaking order, because that was preceding confidential session. If not, we'll go to Deputy Mayor Helmer. Councillor Salee, do you have something to add?
You can go to the Deputy Mayor. I have on the main motion.
Deputy Mayor?
just briefly along this line of inquiry, I wonder through the chair if the city manager or the medical officer of health want to talk about why the date of the end of the year was chosen, and if the situation on the ground changed and the bylaw was not seen to be necessary anymore, what the process would be for repealing it in advance of the December 31st date.
Happy to start with Ms. Livingston, and if appropriate, Dr. Mackey as well. Ms. Livingston?
Yes, thank you, Your Worship. And through you, the end of year timeline was developed in discussion with Dr. Mackey, so I'll defer to his advice to you about that. What I would say to you, though, is if it seemed that we were improving in the community and Dr. Mackey would suggest that we could rescind it, then we would move quickly to bring forward to council a recommendation to rescind the bylaw sooner. But I would ask Dr. Mackey to speak about some of the concerns that he had around what may or may not occur in the fall.
Well, we're in luck. He's right at the microphone. Dr. Mackey, do you have some thoughts on this, please?
Thanks very much, Mr. Mayor. Through you, we certainly have experience in the past with pandemic waves coming in the late fall. And so some of the other municipalities that have developed this sort of bylaw have had it sunsetting at the end of September and then renewing if needed. My impression is that it's most likely to be more needed than it is now. The H1N1 pandemic, which came in 2009, was out of season because it came early. Essentially, it was the front tail end of flu season, which was right around end of October, beginning of November. So this particular coronavirus hasn't perfectly followed the seasonality that coronaviruses usually do, which is the same as flu, peaking in February and sort of dying off by April. It's been out of season a bit, just like the first wave of the H1N1 swine flu pandemic was. And we could have a out of season in the other direction, such that this is something that after school restarts and life really starts to get more back to normal, we see the activity of coronavirus really ramp up again.
Deputy Mayor, follow-up?
So two things. One, I'm happy to move the recommendation in the report. It seems like we're getting into amendments before the actual bylaw is on the floor. I'm not sure about the amendment that Councillor Morgan has suggested. I think there could be a couple of different reasons why this regulation might be revoked. So one is, things could be good and stage 3 is no longer necessary because we're moving on to some future stage that doesn't even have a description yet, potentially when the bud gardens could be operated safely and we've got mass gatherings inside happening again. It could potentially be revoked for another reason, which is everything is getting worse. And, stage 3 is no longer on the table and we're moving back into stage 2. And I just am a little concerned about the sort of legislative approach of crafting something that is contingent on the action of the provincial government. I like the idea of having some flexibility around when the bylaw is repealed, because I think when the situation on the ground is different and it's no longer necessary, there's going to be a need to remove the bylaw. And so I want to make sure that we're not enacting it for a unnecessary length of time or at a time when it's not recommended by the medical officer of health. So I think that Councillor Morgan is right to kind of focus in on the timeline. But I'm not sure about the strategy of crafting it so it's contingent on the existence of that specific regulation. So I just flag that as a potential area of concern. I'm not sure how I will vote on it. I'm not sure stage 3 is going anywhere anytime soon. So I'm not sure that there's a huge difference there. I am concerned that the very weakness that exists for the instruction is now being included in the bylaw, which is one of the strengths of having a bylaw approach is it's not contingent on those orders. So I think I'm not in favor of it, but I'm going to think about it a little bit more and look forward to the comments from my colleagues.
Thank you, Deputy Mayor. I checked with the clerk, who has all wisdom, and I've been advised that we could just go right to the amendment. But you know what? Let's do it the way that we've indicated. You've put the bylaw as presented on the table. We'll get a seconder, and then we can look to Councillor Morgan's amendment for that purpose. Do you have a seconder, Councillor Cassidy, to second that? Thank you. So we also have, colleagues, an amendment there from Councillor Morgan, seconded by Councillor Lewis, to the suggested bylaw on the floor. I have Councillor Squire and Councillor Lewis to speak to it.
Thank you, Mr. Chair. I want to speak to the amendment first.
Yeah, we're dealing with the amendment.
Yeah,
Please
I
go
want to
ahead.
speak to the amendment first. And here's my challenge, and it was the same challenge I had before, and I take it very seriously, and that is that the public expects, and one of the things that's happened in the last week, and I'm sure we're all aware of this, as soon as this issue starts hitting the public looks squarely at city councilors and says, what are you going to do? What are you going to do? And there's been a huge level of misunderstanding in the public as to how this entire thing is work. In fact, I spent most of my time clarifying that there was an order that came in effect Saturday, regardless of what council did. So it's really important to be clear, and I think whatever we do tonight, that's going to be the most important thing, is clarity coming out. The other thing I'm worried about that, but I'll tell you what I'm largely worried about, and this is not an aspersion, and don't anybody take it as an aspersion on any particular person, but here we are once again, taking what is a huge and important issue to most of the people in the City of London, masks, and how long the duration is going to be, and we're passing the decision to bring it back or do whatever we can on that date. We're handing it off to staff, away from council. So what I heard from Ms. Livingston is, well, if we start to feel things are getting better, we're going to talk to Dr. Mackey, we're going to have a chat, and then we'll decide if we're going to bring it back.
Sorry, Councillor, I don't think that's what was said, but so I just
I think
asked
it was.
I'll let you continue.
Yeah, that's largely the danger that I see. So this whole issue, at least from my point of view as a councillor, has largely been out of my hands in terms of discussions, various things. So what I'm worried about is that there's no review by City Council before that December 31st date that's automatic. And that is my concern. I would like to see this issue at some point come back in a manner that it's here today, with Dr. Mackey speaking to us about what he sees the situation as and what he sees the need as, without having to be a translation through other bodies. So that's where I'm concerned right now. I think maybe what Councillor Morgan is doing could be crafted better, but surely there's a solution to make sure that council has an oversight function here and a response to our constituents. And we don't just say when we leave this room, well, it's December 31st, but it might be earlier. We don't know. We have to see. Dr. Mackey will look at it. That's just not quite good enough for my constituents at this point.
And just as a point, we're talking about this being a health issue. Ms. Livingston, did you want to comment on there before I keep going? I'm not trying to put you on the spot. I don't know if you had anything you wanted to add to this before I move over to Councillor Lewis.
Yes, I would like to, Your Worship. I would like to clarify that as we were asked by Council to consult with Dr. Mackey in the development of a legislative measure, so too would we continue if Dr. Mackey made a recommendation about changing that legislative measure. That is what I meant when I made my comments in response to Councillor Squire's question.
And I thought staff was taking the direction from Council, to be clear on that. I'm going to come back to Councillor Lewis, and then no one else is there at this point. Councillor Squire, I'll come back to you.
Yeah, I just want to say I have no problem with what Ms. Livingston said at this point in time. That's my understanding of what the process would be, and I don't think we actually differ on what the triggering event for that advice would be. So
thank you. Councillor Lewis.
Yes, thank you, Your Worship, and I agree with a fair amount of both what we just heard from Councillor Squire and from Ms. Livingston. And I want to go back to what Deputy Mayor Helmer said. Yes, it is possible that the situation could get worse. That's one of the reasons I think it's actually important to align this bylaw with the Stage 3 opening of Ontario, because if the situation gets worse, I think it's actually incumbent on us to call Dr. Mackey back and say, what else can we do? And that may be the case where we have to then say to employers like General Dynamics and 3M and other large employers in the city, you have to have masks in the workplace now. So by tying it to stage 3, whether the situation gets better or worse, it says when it has to change, it comes back to council. And if nothing changes by December 31st, then it still comes back to us for a check-in. And I think it's incumbent on us to make that check-in, even if the situation hasn't changed. But I certainly think it's incumbent on us to be involved in the discussion if the situation gets better or worse. And it should be, and I say this with all due respect to Ms. Livingston, because I know that she and the staff will continue to do the great work behind the scenes that they do. But staff shouldn't have to come to us and say, we're considering rescinding the bylaw because situation X, Y, or Z has occurred. Staff, we as a council should be taking action when the situation changes. It's been put on us to make this decision, so it should be up to us to make future decisions around changes for it, not put it on to staff to come back to us when they feel it's necessary.
Okay, but I want to be clear, colleagues, that we were the ones who directed staff, and they've come back to us with the bylaw now currently being considered as amended. Any other comments or questions as we to the issue of the amendment? Councillor Lehman.
Thank you, Your Worship. So I think this is a good amendment. We've reached this point rather quickly without any public participation meetings. I think that's probably not the best, but I understand the need for expediency given the seriousness of the issue. Let's say things, what was raised is what happens if things get worse. Dr. Mackey commented on that. Well, quite frankly, if things get worse, I would hope that there would be a Section 22 order that would deal with the situation, because I think Dr. Mackey referenced that. He didn't feel comfortable making that movement now because things are not in that bad a shape. He's concerned about not getting to that point, and he thinks we can step in to add assistance so he doesn't have to go outside a realm where he does not feel comfortable. So I think this allows us to recognize that if things continue on and, you know, phase 3 is ended, and who knows if it will or not. If it doesn't, then we will continue to December 31st. But I agree with some of the other comments that at least by December 31st, then we will have, you know, a full discussion again about where we're at and where we're going. So I will support this motion.
Thank you. I have Councillor Van Holst and Deputy Mayor Helmer.
Thank you, Your Worship. So we've received many communications on this topic, so my colleagues are well aware that Londoners aren't unanimous about us implementing a bylaw. People have told us that we're crossing a line that could be subject to a charter challenge, and they don't want to be forced to do this. And when I listen to Dr. Mackey saying that the bylaw is more needed at the end of the year than now, and when we realize that he's already made an instruction that seems to be being well received. Councillor Lehman just said we haven't had the public participation meetings that we could have had on this topic. My desire would be for us to refer this matter to the September, I should say the August 11th SPPC meeting, because that will give us a chance to see if the instructions are going fine. Perhaps we don't need to tell Londoners to take up the cause of masks, so we don't have to force them and send enforcement after them. They'll just do that. I see that the businesses are there handing out masks, and I prefer that people just do things of their own accord than have us be heavy-handed unnecessarily and and frankly prematurely. So I'm going to make a motion that we refer the discussion to that date. That will give us a chance to figure out some of these details. Or remember, this came to us at the very last minute.
I think we've got that, Councillor Van Holst. I apologize. You've got a referral there, which does take precedence. So that's why I'm going to push Deputy Mayor Helmer back, unless he wants to speak. But this will require a seconder for this to go forward. Do you have a second?
Yes, I look for a seconder.
All right, thank you. Is there a seconder? I do not see a seconder.
Thank you, Your Worship.
Thank you. Deputy Mayor Helmer.
Thank you. So I appreciate the clerk sending around the language for the amendment that's been proposed by Councillor Morgan. I wonder if through the chair, I don't know if the question is for Dr. Mackey. I guess I can have two questions. One is related to the December 31st date. Dr. Mackey, I wonder if you could just speak to why that is included in the bylaw now. And second, I think through the chair, perhaps to Mr. O'Brien, who's familiar with the Emergency Management Civil Protection Act. Under what circumstances would the provincial government revoke one of these regulations? I know there's sort of ones we might anticipate and expect, and then there might be some other ones that maybe are a little bit less likely. Maybe there was a mistake and something needed to be fixed. I just wonder if he wants to weigh in on when those things are revoked. I know a number of orders that were made earlier in the pandemic have already been revoked at various times throughout the process. So first question for Dr. Mackey, and the second question for perhaps Mr. O'Brien.
Dr. Mackey, to you, why December 31, please? Sorry.
Through you, Mr. Mayor, December 31, I have to admit, is not a magical date. What we did is we looked at when we could potentially see a next wave being over, but that certainly doesn't mean that there would be no need for masking at that point. So from my perspective, there's no medical reason why this needs a sunset date, but there may be a legal reason. You definitely want to get another perspective on that.
Before I refer the next question to Mr. O'Brien, Deputy Mayor Helmer, did you have a follow-up to that?
Just wanted to, I do have a quick follow-up. So you'd be okay with a later date, but you're not recommending an earlier date?
Dr. Mackey?
That's fair to say. And Mr. Mayor, through you, I don't see the date issue as particularly black and white. If we pick an early date, it could be extended. If we pick a late date, it could be rescinded. I mean, obviously you would all know the mechanisms for doing that better than I would, but we should be, as a community, reacting to what is actually happening. So I would hope that whatever date is picked, it is somewhat flexible.
Are we going to extend your next question, Mr. O'Brien, Deputy Mayor? Mr. O'Brien, do you need the question repeated?
Thank you, Your Worship. I believe I understand the question. So the province is continually evaluating the orders that exist under the Act, and based on the impact of the virus across the province, are continuing the orders, rescinding the orders, or amending the orders as needed. There is no specific timeline associated to them except based on the impact the virus is having at the provincial level. There is legislation currently at the provincial level that would allow the province to rescind the declaration of an emergency, but allow them to continue with the orders under certain provisions. So there's no specific formula outside of the impact the virus is having per se.
Deputy Mayor, you're good with that? I wonder if I could turn the chair to you for me to make a comment, Deputy Mayor?
Go ahead.
Thank you very much. So colleagues, I support this amendment. What I think it does is it provides balance. what I think it does, it's trying to balance care, because we've heard in earlier comments, I think elucidated by Councillor Squire, about where we go from legal to political, and let me say to healthcare. This is about trying to do the right thing for and by all in terms of our citizens. I think the second, you're balancing care, you're also balancing collaboration. And that's that collaboration and working with the Middlesex London Health Unit, and working with them working with our city and if I might say Middlesex County, to the extent that this isn't tied in directly, but certainly we have that connection. And through the dialogue I've had with the warden, I know she is working with the medical officer of health with regard to doing working with her various municipalities. And I think the third piece is communication. I think we've heard from a number of colleagues about the importance to get inputs from appropriate groups. We've all had our own communications through, in some cases, some of our ward residents, city residents, and people from afar. So when you have something that balances care, collaboration, and communication, to me, that's, I think then we've struck the appropriate mix. So I'm prepared to support Councillor Morgan's recommendation for this. Any other comments or questions before we call the question to the amendment? Councillor Cassidy. Go ahead.
Thank you, Your Worship. I wonder, through you to Councillor Morgan, if there might be like some addition to the amendment, having heard from Councillor Squire wanting to hear from the medical officer of health, wanting to have that consultation. So, you know, I see the wording that until December 31st or until such time as regulation blah, 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 is revoked. But perhaps some added wording that we would hear from that council would hear from the medical officer of health before that happened. So before we automatically revoke the bylaw, we would again hear from Dr. Mackey and get advice.
So that's a question I think you've directed to Councillor.
To the mover.
To the mover, but it also happens to be Councillor Morgan, so let's ask him.
Well, here's the challenge I had with this is I had to ask our staff a lot of questions on how to actually make this functional, because my goal here was to tie this to the regulations, the same regulations under which Dr. Mackey derives the authority to issue the instruction. So I'm unsure how to word that properly, and that being said, I don't think it precludes Dr. Mackey from coming and giving us advice on a regular basis. I just don't know if it would align with some sort of cancellation. So I see what the councilor's trying to do. I don't know how to properly word that. Quite frankly, I struggled to try to get this in an effective way because it is a bylaw that our staff have to enforce. So I don't have a specific answer to the councilor's question because I don't know what the wording would be to do that and whether it would change the ability to enforce the bylaw or make it effective.
And maybe it becomes to you, Councillor Morgan, and to all of council, a function of vigilance, so that we pay mind to the dates as they come forward. And Dr. Mackey has been gracious enough as our guest to be here for this evening. I'm sure that if we give him better treats next time, he might stay longer, but I think that we could certainly, he's been exceptionally cooperative in working with us. And we would expect no less, but he's certainly given us that and more. So I would think that he'd be exceptionally obliging to do that, if I can presume for a moment. So if we don't need to put it in the bylaw, but know that he would that he would be willing, as appropriate, to bring that forward to us, if that would satisfy your concerns, Councillor Cassidy. Okay, good. I see Councillor Salee. Go ahead, please.
No, I'll just wait to speak when I get a chance. Never mind. I think I was going to try to address it through my motion later.
Okay, I now have Councillor Morgan would like to do a wrap on this. Go ahead, please.
Well, Your Worship, I only want to do that if everybody that's done speaking, so I don't know if we need to make sure everybody else is.
Yeah, I didn't see anybody else on this list. Councillor Morgan, last opportunity. Why don't you go ahead, please?
Colleagues, what I'm trying to do here, based on the discussions that I've heard, is find something that can be supported by all. It may not be something that everybody's happy with, and in fact, I'm quite a talent for carving out a position that makes nobody happy with me, and that usually works out okay in the long run. I think phase 3 is going to be around here for a while, but I think it is really important that we tie our decision to the actions and the orders issued by the medical officer of health. And the reason why I think we do that is because I believe the further that we stray from that, the more this becomes a more pure political decision. And when we get into a more pure political decision, as you've heard some comments today about public participation meetings and engagement, we move to that part of decision-making that aligns with the traditional way that we make decisions. For me, and I hope for many of my colleagues, this is a very pure health issue. This is a health emergency, and we need to have the full confidence in our medical officer of health to help us handle this. And so my desire to align it with those is to keep this in the health space, to allow us to move quickly and expeditiously, and quite frankly, around some of the regular processes that we may entertain or engage in on this because of the urgency. But the further we move into assigning dates that may not be linked to that, the more I think we need to move into a more traditional process. And so that's my desire for where we've landed, and I hope it'll be supported. And certainly I know that no bylaw is ever going to be perfect, and what we do have is the ability to change, amend, and adjust those bylaws as we move forward as well.
Thanks very much. We have a duly moved and seconded amendment. We'll call the question. We will call the question after we ask the clerk to just to read it, just because we've had some passage of time, and for the benefit of the public, we'll confirm what it is that we're voting on. Go ahead, please, clerk.
Thank you. Through the chair, this is an amendment to the proposed bylaw that's circulated, and the amendment reads that the draft bylaw be amended in section 25 by adding the following after the words "until December 31st, 2020." Or until such time as the regulation OREG 36420 rules for areas in stage 3 made under the Emergency Management and Civil Protection Act RSO 1990 chapter E9 is revoked.
Thank you. We will call the vote in just a moment. Councillor Van Holst.
Yes.
Councillor Lewis.
Yes.
Councillor Slee.
Yes.
Deputy Mayor Helmer.
No.
Councillor Cassidy. Councillor Cassidy.
Yes. Yes.
Thank you. Councillor Squire.
Yes.
Councillor Morgan.
Yes.
Councillor Lehman.
Yes.
Councillor Hopkins.
Yes.
Councillor Van Meerbergen.
Yes.
Councillor Pelosi.
Yes.
Councillor Kayabага.
Yes.
Councillor Hillier.
Yes.
I vote yes.
The motion's carried 13-1.
Now we have the main motion on the floor. I think Councillor Slee, you had something you wanted to add?
Yes, hi, Mr. Mayor, thank you. So I had a question that I asked earlier, and I wanted to ask by administration. As far as the enforcement of this bylaw goes, how will bylaw be doing this, recognizing that part of this enforcement might lead to London Police being able to do that? I know that they weren't, I know they weren't necessarily invited to this conversation, so they won't necessarily have an opportunity to respond today. But I'm just trying to understand practically how this is going to be a reality for Londoners, because I anticipate that there might be instances where folks refuse to want to wear their mask, and then they're at, whether it's at a restaurant or something like that, and it leads to conflict. And I'm just kind of wondering how administration sees this rolling out.
I'm not sure to direct that to Ms. Livingston or Mr. Kostovas.
It's Mr. Katolik here. I can
Forrest,
answer
sir.
that question
Thank
through
you.
the chair. Your worship, the bylaw will be focused on a three-pronged approach. Firstly, education, voluntary compliance, and enforcement if necessary. In terms of how the protocol is going to work or proposed to be working, is that we will focus on proactive enforcement initially, and that would greatly be focused on education to the operators of the establishments and to the public. And as we anticipate, we will receive complaints as we received complaints in previous provincial orders. We will not be going out to every complaint because operationally, it's just not practical. So we will triage all the complaints and we will attend hotspots to educate employees, to educate the public, and take only necessary enforcement action if required.
Thank you. Councillor Salee.
Thank you, and thank you, Mr. Katolik, for that response. My other question I had was in Section 6, apologies if I'm going to read it real quick, notwithstanding Section 2, this bylaw does not apply to any officer, city employee, or a person hired or engaged by the city to do the work or perform services within an establishment for the specific purposes of performing policing, municipal, or enforcement services, including but not limited to the enforcement of this bylaw or the provisions of any act of parliament or the legislator or an order made under an act of the parliament or the legislator. And I just read it for the members of the public so that they could follow. And my question to civic administration, or maybe it's Dr. Mackey, can someone articulate why this was included in the bylaw? I mean, I guess I have my reasons, but I think it will be helpful for the public to understand, because I think the public might see law enforcement or municipal bylaw officers not themselves at times wearing a mask. And I just want to help set the stage there. So if you can properly, so if I get a response, it'd be helpful.
Well, let's see if we can find a response from some nice folks there. It could be Dr. Mackey, if you'd like to come forward with some thoughts, and then if staff want to add to that, they can. Dr. Mackey, your thoughts?
Thank you, Mr. Mayor. With apologies, I'll ask the councillor to please repeat which section it is that you're asking about included, why it was included.
I think it was Section 6, but go ahead, Councillor Salee.
Correct, Section 6, the exemption for law enforcement, essentially, to not have to abide by the bylaw during their functions.
Yeah, through the mayor, two issues there. First of all, we did not want to interfere with emergency services in any way. You'll note that hospitals aren't covered, for example, in this in any way. Second is that there are guidelines through that emergency services are using now. I would strongly recommend that emergency service personnel wear those masks whenever they can, and also there will be times when it may interfere with their duties. So that's the main reason. Really trying to avoid situations where requiring a mask might cause some kind of harm.
Councillor Salee.
Thank you, Mr. Chair, and thank you, Dr. Mackey. So just some commentary from myself. So I think on the last item that I was just inquiring about, I think it's important for the public to recognize that if this passes, that they might see by law enforcement or police officers at times not wearing masks, and I just think that it's helpful to just really push that out there in the messaging so that people don't feel as if law enforcement are being treated differently and as if they're completely exempt from this legislation, so it doesn't create further difficulties in our community. That being said, separate from that comment, my other concern is, the enforcement of this and how we actually do this. I support mandatory mask. I think, based on what I've heard today and the limited research that's out there, that says that this could potentially have a positive impact and potentially maybe even save some lives. So I'm supportive of that. But my concern is just, some of the instances that may arise from this and some of the communities that might be specifically impacted by enforcement. So maybe my other question is and maybe it actually kind of will assist Councillor Maureen Cassidy when she was asking about about Dr. Mackey or somewhere. I can't remember which counselor it was, but anyway, my question is would it be reasonable to ask staff to at least within every 60 days to report back on this particular bylaw, whether it is how the enforcement is going, its effectiveness, and, to allow us to, kind of reflect and kind of consider what we need to do. Because my concern is that if it's something that's being over-exercised, that it could be problematic. And the reason why I say that is somewhat needed is because once we pass a bylaw, it's essentially out of our hands, because then it becomes operational, and then we can't interfere with Mr. Katolik when he's enforcing it with his team, and we can't interfere when police are then enforcing it. So those are kind of my concerns. So I'm not sure if Mr. Katolik or Ms. Lynn Livingston has some comments about being able to come back every 60 days or within 60 days to kind of report back. And I'll maybe ask for the mover and seconder to either see that as a friendly, or maybe it'd be easier if I just do it as an amendment.
Well, let's just see first. We'll get some response first if I can. We certainly have the ability for Mr. Katolik to come back and provide through committee. But let's just see if Ms. Livingston, if you have some thoughts around this, because and by the way, Councillor Kayabag, I'm not ignoring you. I saw your hand up, but we're just dealing with this issue for the moment here. Ms. Livingston, thoughts around that, so that you can just give us a little guidance, please?
Through your worship, should council wish a report back on the progress with respect to complaints received and how we've been responding, I don't anticipate an issue with that. I would respectfully ask that it not be every month. We have a lot to do with respect to COVID, but if council would like a report at an appropriate time, then I don't see any concerns about that.
So reimagine, Ms. Livingston, this would go through committee or through SPPC? If let's say we said quarterly, and I'm just throwing it out there, and it's going to be ultimately between the councillors, his thoughts, and how we want to take this through in the will of council. But what's your view on this in terms of the right place for it?
Through your worship, all things related to COVID have been coming back to SPPC, so I'd anticipate that that's where this report would land.
Okay, thank you very much. Councillor Kayabag, we're not ignoring you, Councillor Salia. I just want to get Councillor Kayabag weighing in here, please.
Thank you. Through you, Chair, perhaps one of the things that we could look at, given that this motion is going to be, or this bylaw is going to be ratified at council tomorrow, at the same time as the motion that we moved at SPPC last week is going to be ratified as well, where staff are asked to use an anti-racism lens on different service areas. This is perhaps something that Mr. Katolik could look at. I don't know if he could comment on this, on some of the ways that during enforcement they could reduce any discriminations and barriers towards people who normally have these complaints, and especially homeless people as well.
Mr. Katolik, we hate to give deadlines, but did you want to comment on the councillor's thoughts?
Yes, through the chair. Enforcement will occur following education, voluntary compliance, and enforcement in terms of ticketing when necessary. And as every bylaw, it's at the discretion of the officer to issue a warning or issue a charge. And we will certainly focus, as I mentioned earlier, very highly on education with respect to any homeless individuals that we may come across in response to a complaint within an establishment, or anybody within an establishment. Education will be the primary connection with that alleged violation.
Thank you. Does that satisfy you, Councillor?
I have a follow-up question, if it's possible. Thank you, Mr. Katolik. Through you, Chair, I'd like to ask perhaps if he can comment on once the motion is ratified tomorrow at council, which again recommends that staff implement an anti-racism lens to different service areas. I'm interested to know if this is something that Mr. Katolik is going to take upon, especially looking at this masking situation as well. And what are the education piece is going to be both ways, the community education piece and then the staff communication piece as well, or like how is that going to work out?
Before I ask Mr. Katolik to respond, I should share with council that with the education approach that we took as COVID, the pandemic came upon us, I would only say that that the education piece was for months and months, and it was an exceptionally helpful piece. Mr. Katolik, do you want to respond?
Yes, through the chair. I'll give an example of the education that we employed earlier on in this pandemic. We issued 1,200 warnings to individuals and businesses within parks and in businesses that were operating not in compliance with provincial orders, and only issued 54 charges. And anybody that received a Part 1 ticket has the lawful opportunity to challenge that in the court of law. So I've been asked on several occasions about were certain members of society profiled. And I want to say that our officers deal with every individual with high respect, whether they're living in a tent and we have to move them along at some future date, or whether it's a father that has allowed his children on playground equipment with visual signage in place and playground equipment surrounded with caution tape. So we deal with everybody with due respect, and will continue to do so.
Councillor?
Thank you. Again, through you, Mr. Chair, I don't think I got an answer for my question. I do understand of the work that they've been doing through COVID, but I don't think I got an answer for my question, which specifically addresses the two motions that are going to be ratified tomorrow night, and one of them being that we're asking staff to implement an anti-racism lens on different services that they offer to the community. And I'm just curious to know whether or not this is going to be in full effect with the masking, or like how is that going to work out?
Mr. Katolik?
Yes, Your Worship. As noted in the report, we are going to initially focus on education to the operators and to the public. If we receive complaints, and I highly anticipate that we will, and a complaint may come in that there's a individual, a male, and he's in the grocery store, he's in the meat aisle, and he's not wearing a mask. Operationally, and using common sense, we are not going to attend that premise. However, if we do get a number of complaints and we identify hotspots, that's when we're going to go out and do some further education with the operator and the public within that premise that there is a mandatory masking bylaw. Now, the masks come in various formats, as Dr. Mackey indicated, and there are a number of exemptions, and one of them is underlying medical conditions. So for example, and I'm getting into operational issues, but if somebody is not wearing a mask and we are there through education or voluntary compliance or enforcement, and they indicate to us, I can't wear a mask because I have a medical condition, the conversation ends at that point. It stays cordial, but we will not be asking any further information on why they have that medical condition or what it even is. So that's very clearly outlined in the bylaw and on the public notice that the establishments have to post. And I want to end my comment on saying that our staff is going to continue to respect all members of the public, whether they're providing information or somebody is possibly going to be getting a charge.
Councillor?
Thank you. I think I'll reach out to Mr. Katolik for further discussion on this.
Thanks very much. Any other comments? Councillor Salee, are you, you brought the discussion forward on this. Otherwise, we're going to go back to the main motion. Any other comments from your standpoint?
Yes, I do. So I just wanted to stress as well that once this passes, and I recognize the operational side of it, as stated earlier, this will also fall under the jurisdiction of the London Police Service, which, and you know, so our lens that we have that will hopefully pass tomorrow, that necessarily won't cover the London Police Service and those pieces. But I'll leave that conversation for my my colleagues on the London Police Service board to further those conversations. But within my capacity here, what I do find will be helpful for me to be able to support this is recognizing what the city manager said, that doing it every month might be difficult. So that's why I said if it's possible within 60 days to have a report back, I think it would provide that comfort, and to make sure that it's a conversation that is ongoing. You know, within, you know, it's a significant measure. It's the first time we're doing something of such significance, and a lot of people are very sensitive about this topic. And I think for us to just have a check-in and to see where things are at, because I think, you know, seeing what's happening in other communities and kind of what the negative consequences of some of these bylaws are when enforced, I think it's helpful for us to make sure that we keep a pulse on things, and within 60 days, I think sounds reasonable. So I'll move that at this point, that just a report back comes within 60 days, with every 60 days.
Do you have a seconder? Councillor Kayavaga, comments, questions, 60-day reporting back. Could I ask a question to the city manager based on the comments about hopefully not every 30 days because we're in a COVID crisis? I know this is COVID related, but I'd just like to ask about the frequency in terms of the implications to staff with that kind of frequency, please.
Thank you, Your Worship. We're in the hands of council. If you would like it every 60 days for the length of the duration of this temporary bylaw, then we will provide that. Council is very aware of the situation that we are in terms of staff resources. But I understand the importance of receiving a report back on this issue and how the impact it's having in the community. So we're in your hands. 60 days is better than 30.
Deputy Mayor Helmer. Thank you, by the way. Deputy Mayor Helmer.
Just briefly on this amendment, I support it. I think that's fine. I think there's actually a broader issue, which is there's been a lot of changes related to COVID affecting bylaw enforcement. And I think what we probably are interested in is not just a report on this particular bylaw, but generally what's been happening, even enforcing the provincial orders, which we've occasionally had sort of information provided by Mr. Katolik. He just reeled off some numbers there in response to a question. But I think what would be helpful is having an overall report about enforcement of all these variety of different things, because many of those things have fallen on the municipal bylaw enforcement officers. I think having a report in a sort of 60-day time frame that touched on this bylaw and also those other things would be fine. And I've just stayed out of the discussion because that I think is a better discussion for council tomorrow than this meeting where we're talking about this specific bylaw, although I support having regular reporting on bylaws that we enact. So I support this one.
Thank you. Councillor Squire.
I'm supportive of the idea, through you, Mr. Chair, of having reporting back. Obviously, the thing that would be also helpful is to know where we are in terms of masks. Are we seeing this as something that's going to be much longer than we might imagine? And if we get that information secondhand from Dr. Mackey, that would be fine through Ms. Livingston. And for me, it's a matter of being able to inform the public, so the public knows where we are in the pandemic and where we are. Because the wearing of masks inside, as we all know today, is going to be onerous. It's going to be very onerous on people and businesses. So just a short summary on even that issue would be tremendously helpful.
Thanks very much. Deputy Mayor, are you coming back in or are we done? Okay.
Getting on the list for the main motion.
Well, we've got, you're getting ready for that, are you? Okay, let's deal with the amendment moved by Councillor Salee, seconded by Councillor Kayabaga. This is the amendment. In a moment, I see no other speakers. We will call the question in just a moment.
And Mr. Mayor, just for clarification, because I recognize my colleagues, the Deputy Mayor and Councillor Squire talked about broadening it up, and I just want to make sure that that captures that, because I know my comments were specific to the enforcement. I apologize for not asking to be recognized first.
Why don't I have the clerk just read it, and then that way, if we'll make sure that we've captured that which needs to be captured. Go ahead, please, clerk.
Through the chair, the motion that I have drafted, moved by Councillor Salee and seconded by Councillor Kayabaga, is that the Civic Administration, in conjunction with appropriate stakeholders, be directed to report back to the Strategic Priorities and Policy Committee in 60-day increments with respect to the proposed bylaw related to mandatory face covering.
Councillor Salee, does that reasonably capture it?
I think if we just, to capture what Councillor Helmer was saying was bylaws related to, I guess, COVID-19, I guess would be a little bit more broader to capture things. But maybe I'll defer to the Deputy Mayor.
Deputy Mayor, I know there's someone else in between, but I need to hear from you then on this, please. Deputy Mayor?
I'm going to put a bit of a sharper point on what I said earlier. This meeting is a special meeting to deal with the bylaw that's in front of us and not other things. So that's why I have not made any motions related to other reports about other bylaws and other activities of enforcement officers. I'm happy to bring that up tomorrow at council.
I have Councillor Van Holst on the list here. Go ahead, Councillor.
Thank you, Your Worship, and I'm pleased to support a report back as well. Earlier, I asked a question about the cost of masks, and because that's a piece of information I'd be interested in a report as well. We're going to be asking the community, and we ourselves are going to be investing money in masks in a very untargeted fashion. And so, you know, I always wonder, what could we do to help those most vulnerable, as opposed to everyone who may be quite healthy wearing masks. So that'll be one piece of information I would like to see on such a report, but the motion seems like it would cover that as well. So thank you.
Yeah, I'm not sure that it does cover that. Frankly, I'm not sure this is the place for it as well. But you know what? I think to the Deputy Mayor's point, we will have some fairly direct discussion on the whole issue tomorrow. But we do have an amendment on the floor, colleagues, as read by the clerk, duly moved and seconded. So forgive me, Councillor Van Holst, I see your hand still up. Did you wish to add anything further? Okay. Thank you very much. Councillor Hopkins.
Thank you, Mr. Chair. Could I have the motion or the amendment read out, please?
I thought we just did that, but if it would assist council, let's just go through that again. Please, clerk, if you would.
Thank you. Through the chair, the motion on the floor is that the Civic Administration, in conjunction with appropriate stakeholders, be directed to report back to the Strategic Priorities and Policy Committee in 60-day increments with respect to the proposed bylaw related to mandatory face covering.
Councillor, are we good? Thank you. I see no one else on the list. I wonder if we could call the question. Looks like we can. Councillor Van Holst.
Yes.
Councillor Lewis.
Yes.
Councillor Salee.
Yes.
Deputy Mayor Helmer.
Yes.
Councillor Cassidy.
Yes.
Councillor Squire.
Yes.
Councillor Morgan.
Yes.
Councillor Lehman.
Yes.
Councillor Hopkins.
Yes.
Councillor Van Meerbergen.
Yes.
Councillor Pelosa.
Yes.
Councillor Kayabaga.
Yes.
Councillor Hilliard.
Yes.
I'll vote yes.
Closing the vote, the motion is passed 14-0.
We still have the main motion, colleagues, to deal with, which has been already moved and seconded. Any comments or questions? Deputy Mayor.
Thank you. I wanted to talk about the substance of the bylaw that's in front of us. First, I wanted to say thank you very much to the city manager and the city solicitor's office and Dr. Mackey for turning this around very quickly. I know that we asked you to do something at a very short time frame. I think everyone recognizes the urgency that is involved in the public health emergency that we're dealing with. But I did want to recognize that you've done a wonderful job to get us the report and to spend so much time answering, especially Dr. Mackey, answering all the questions from the colleagues around the Horseshoe and on the Zoom about a whole variety of issues covering a very wide range of topics. And I know it's not a small thing to just turn that around. I know you have many other things you got to be working on, especially the city manager. It's not like there's just masking or just COVID. There's many other things that you are responsible for. On the issue of the masking bylaw, I think that it makes a lot of sense, and I support it very strongly. And one of the reasons I support it is that it's recommended by Medical Officer of Health, and I do think the Medical Officer of Health needs to be the lead and has been the lead on the public health response here at the local level in Middlesex County and in London. But I also think it is squarely in our responsibility as municipal legislators to put legislative measures like this in place. And in many other cases, when there is a good reason to do so. And I see the kind of two areas where this makes a lot of sense to me. One is on the public health front specifically, which is, is it going to help us prevent the spread of disease, slow down a resurgence, prevent cases, potentially prevent serious illness or death? And I see in the presentation from Dr. Mackey and other materials that I've been able to read that there's good evidence that there's some marginal benefit to that. And I think it is a step from a public health perspective that makes a lot of sense. The second one is more about the economy overall and the kind of devastating economic impact that the public health measures that we've taken so far, many of which are much more coercive than requiring the wearing of masks. Sorry, all your businesses are shut down, all these different things that have been done to prevent the spread of disease in our community at the provincial level, at the federal level, preventing people from entering and leaving the country, closing the US border. These are very significant measures that have been enacted at different levels to control the spread of disease. Wearing a mask, I think if I were to grade it on the sort of degree of coercion, this is a pretty small thing to be asking of people. Not being able to see your loved ones in long-term care for months. I think that was a very significant measure enacted at the provincial level that have really difficult consequences for people. And I think wearing a mask is a small thing we can ask of people to try and slow the spread of the disease in our community. But from an economic perspective, I think it can really support a strong recovery. If people look across the shopping aisle and they see someone else wearing a mask, I think it reinforces for them that that person is looking out for them, that they care about them, that they want them to be safe and that they want them to be healthy. I think for the clerks who've been working, especially in the essential businesses who've been working this whole time, providing support to customers, getting them the things that they need so they can keep living their lives. When they see the customers come in wearing a mask, I think it sends a message to them that the customers care about them, that they want them to be safe, they want them to be healthy. And I think it's a matter of mutual respect. And the more people who are wearing masks, and there's lots of ways to get there, a mandatory mask bylaw is just one way of trying to get more and more people to wear masks. I think the more people who are wearing masks, the more that feeling of we're in this together, we are trying to get through this together, will take root in the community and will be a strong norm. And I think that strong norm is going to support a strong economic recovery. And so I think from two perspectives, public health, I think, the evidence is that the physical distancing is the most important thing. Hand washing is critically important. The wearing of a mask, though, you see more and more evidence saying, this could also help. And so I think asking people to wear them and to have a bylaw that says you have to wear them for a limited period of time as we try and get through this pandemic, it makes perfect sense. And then I think it really supports an economic recovery that will be strong here in the city. And I am concerned that if we don't require something like this, and we don't have a large percentage of people wearing masks when they're out and about, engaging in economic activity in this community, that the economic recovery will be impaired because people will be afraid. They'll be afraid to go out. Consumer confidence will suffer. Because consumer confidence is suffering, the economic recovery will be weaker. Not generally in the province where many people are requiring the wearing of masks, but specifically in our area. And we definitely do not need that. So I think there's lots of reasons to support the mandatory mask bylaw. I know that these kind of coercive measures where we require people to do things, I'm sure people would prefer that they were not necessary, that we didn't have to do them. But I think that it's gonna be a positive thing for the community. I think it is necessary right now. I hope that we can avoid a resurgence in the second wave, which I think is a matter of when and how big rather than if. And that it will help us get through this next part better than if we had not enacted it at all. So I hope colleagues will support the mandatory mask bylaw. It's been recommended by the Medical Officer of Health. I think it makes a lot of sense for those reasons.
Thank you, Deputy Mayor. Councillor Lewis.
Thank you, Your Worship. First, I'm going to say, or first through you, I have a question for our staff. I don't know what the process was that got them to this, but as I look through the bylaw, and I'm very mindful of the fact that Mr. Katolik has said, you know, we're going to take an education first approach. But I do wonder where we reached, because there's quite a range, and I realize this is for both individuals and businesses, but we have a minimum fine of $500 and a maximum fine of $100,000. I know that there are provincial regulations around the amounts that can be charged for bylaw infractions. They're not meant to be cash grabs. So I just wonder if staff can comment briefly on why or how this amount was reached.
Mr. Katolik, do you want to give a go at that?
Yes, Your Worship. Through the chair, we consulted with other municipalities that were debating or have gone through the similar process. So, for example, Burlington, Toronto, Brampton, Kitchener-Waterloo region. There's a variety of range of Part 1 ticket values ranging from $200 to $1,000. We feel that the $500 Part 1 fine is in line with the seriousness of this issue, and also in line with the provincial fines that were set through all the various orders. So, for example, playing on playground equipment when the equipment was closed was $750 plus a victim surcharge. So we're confident with that, but we're in your hands if you wish to, council wishes to lower that or provide a higher amount. And then the maximum level is something that we place in a number of our bylaws, and that would be set by a justice of the peace. And that would be for a Part 3 charge where a summons is issued. And I can tell you from my experience that for other bylaws where we go to a summons, normally the fine is a very small percentage of the maximum.
Thank you. Councillor Lewis?
Thank you, Mr. Katolik. And I just did want to get staff's reasoning. I have no interest in micromanaging and getting into the weeds over what the fine level should be in this circumstance. I'm glad that you've done your homework and compared this with what other municipalities are doing. I just want to comment briefly on the main motion. And I say this with all due respect to Deputy Mayor Helmer. I don't think it's up to any of us to decide if it's a small thing we're asking people to do. And I think we heard from Dr. Mackey as well. We don't know everybody's personal story. We don't know what anxieties this may cause them. We don't know what their experience might be with PTSD or with personal beliefs. And I think it's very, very important to emphasize that for some people, this may be a significant thing we're asking them to do. So this has been said several times through public messaging and through other means. It's not up to the general public to police this bylaw. It's not up to us to mask shame. Don't presume that we know an individual's story if they're not wearing a mask. Do your own part as an individual, and hopefully we'll be done with this sooner than later. I'm still a little concerned that without a stronger order from Dr. Mackey, we are going to be dependent on 8 other lower tier municipalities to adopt bylaws of their own for a regional approach. And that's one of the reasons that I've consistently said I felt it was best that we follow the health unit's leadership on this rather than wing it on our own. I'm still concerned about that regional approach because thousands of people every day commute in and out of this city to work and shop. And for some people, the economic choice might be that they're going to now go out to a Thorndale or an Ilderton to do their shopping, and they'll make that choice too. And I'm sure that in Thorndale, Kelly Elliott will be happy to welcome them. But there's going to be trade-offs to this decision. So I don't think that we should dismiss it as a small thing. I think that for each business, for each individual, they have to, for themselves, feel inside what this means to their contribution to the efforts to fight COVID. So particularly with the amendment that we were able to have made, I can support this for now. I think we need to keep a careful eye on it. I'm going to continue to listen to what Dr. Mackey has to say in the future about the effectiveness of these masks, particularly the non-medical ones where the data is very preliminary at this point. And we will see. I think we also have to weigh the balance of the overall community benefit. And right now we have very preliminary data, so it's hard to do that. If the data comes back though in 6 months and it says, you know, you're improving public safety by 1%, well, then I think we have to weigh the value of this decision. But we're not there yet. We don't have enough information. So to err on the side of caution and support this tonight is something that I can certainly do with the amendments that we've made. So thank you.
Thank you, Councillor Lewis. Councillor Squire.
Thank you very much, Mr. Chair. This is not an approach that I would have taken. From the beginning of this epidemic, I've told anyone who had listened to me that matters of health should be led by the medical officer of health. And it's really unfortunate in terms of timing that an application was made with regard to a bylaw before Dr. Mackey had made a decision whether orders were necessary or guidances were necessary, because that's put us as a council in a situation where people really believe we are leading on this issue. And I've heard that from so many people who have first approached me by saying, why did council do this? Why did council make this order? And I constantly have to correct them and say, we didn't do it. It was properly done by the medical officer of health. And I think that's important, because if I had my way, we would have left it with the order and directions of the medical officer of health on a jurisdictional issue. This is his area of expertise. None of us are experts on health, at least I'm not. The people who have sent me numerous emails telling me yes to masks or no to masks, I don't know where they got that information. So I want to be clear to Dr. Mackey that he is the person I am looking to for guidance in health issues. And now that I'm aware that he likes to hear from counselors, he's going to be hearing probably a lot more from me in terms of what my view is and how it affects my community. Because up till now, I thought it was proper for a counselor to let the medical officer of health do his job, and I will continue to do that. All we've done tonight is effectively passed a bylaw that does the same thing as the medical officer of health. I don't think there's any pretense here that it does something different or in addition. Dr. Mackey mentioned we're showing leadership. I just want him to show leadership on the health file, and I will follow his leadership on the health file. That's what I want him to hear from me tonight. To the people in the community who said to me, who are saying to me, yes to mask, no to mask, they have to understand that my job as a counselor is not to make my own medical decisions. I should be following what the medical officer of health is saying, and I heard from him tonight, and that's good enough for me, and I'm not going to get into any debate about health decisions. I'm also not going to presume to speculate on what this mask bylaw will do that it's going to spur an economy, that it's not going to be inconvenient for people. Tell that to the person running a small business, that in a restaurant, that this isn't going to have a really big effect on them. I would not presume to do that, because I've heard from a lot of people who it is going to affect, and this is not a small thing for them. So I want to respect them and not try to tell them that this is an easy thing for them. That being said, settlements or compromises are something that, for lawyers, they never feel good because you didn't get everything you wanted. My preference would have been that we were not sitting here tonight encroaching on an area that we do not have expertise in. I would have rather the medical officer of health continue to lead. And quite frankly, there's been mixed signals all over the place, and the public is very confused right now, and they continue to ask me questions as I'm sitting here about what these orders mean. What do these directions mean? We have done a terrible job, in my view, communicating what we're doing as a council as opposed to what the medical officer of health is doing. So do I feel great tonight that we've accomplished something wonderful? No. I feel like I've been a passenger on this journey, but I won't be anymore because Dr. Mackey's going to hear from me a lot more. The city manager is going to hear from me a lot more as we move forward on this particular issue, because quite frankly, I did not see this coming. I did not know this was in the works. I did not know anything about this till a week ago. So I will grudgingly support this bylaw as amended.
I don't see anyone else on the speakers list, but Councillor Hopkins, and I would actually, believe it or not, would like to speak as well, but I see a couple of people here. Folks, if this is going to be, though, a repetition, forgive me, I don't mean this directly, of everything that we've said before. I don't want to ever limit independent and fresh thoughts. But we've taken 5 hours to get to this point, and we're getting close. But I need to hear from Councillor Hopkins first, then we'll see who else is on the list after that. Could we please hear from you, Councillor Hopkins?
Thank you, Mr. Chair, for allowing me to speak to this important bylaw that we've been speaking to for the past number of hours. I think it's important, and I know everyone's getting tired, but I appreciate making a comment here. I want to thank Dr. Mackey for his recommendation to mandate masks. For me, it is an opportunity on how we can work together. It's not about anything more than that. It's how we work together as a city dealing with the pandemic that we have to deal with. I have heard from a number of residents, and the first question is, why are we doing this now? And I heard tonight from Dr. Mackey and my own common sense dealing with the fact that we're in stage 3, we're having more people out, and we need to do a mitigation strategy that will improve our recovery and move forward. To me, it's that simple. I think most of the public that I've heard from support it. I've heard from other people in other municipalities that have mandated masks, both from council and from the public, that it hasn't been a problem. And for sure, nothing is going to be perfect. There is going to be some bumps along the road, but it is really important that this just adds another layer, especially with most of the public wanting to mandate masks. I have a couple concerns, though, with the bylaw. I'm supportive of it, but to me, this bylaw is about education and communication. And the fact that we can't even maybe come to terms with the signage. I have a concern. I know staff are going to work on that. I would just like to make a suggestion that both signages that have been recommended by the health unit and by the City of London be melded together, because they're both missing a piece of it. And the more that we can educate the public as to what we can and can't do in different establishments and different ages, I think the better off we will be. I am not, for me, it's also about how we can, so I'm not prepared to wait for the numbers to go up. This is an opportunity where we can deal with these impacts right now to make sure that these numbers don't go up. It's, for me, a decision that it's for the greater good. It's for the community, this decision that we're making. And I have, as time goes on, we're starting to see growing evidence and support that masks do make a difference. That's good enough for me. It's the right thing to do.
Thank you, Councillor Hopkins. I have Councillor Cassidy.
Thank you, Mr. Mayor, and I'll try to be really quick. So just like other councillors have said, I have no comfort, and I would never think to interfere with the medical officer of health and how he performs his role as the chief protector of the public health in Middlesex London region. He's bound by the acts and legislation and statutes in his role as medical officer of health, just as we are bound by certain legislation and statutes as municipal councillors. Part of his role is to know and understand better than anybody else in this region the power and the authority under Section 22 of the Health Protection and Promotion Act. I would never assume that I understand that act better than he does and that he should make an order under that act. Only Dr. Mackey is the resident expert and the local expert on that act. So when he says that the 2 tests that are necessary, that disease is rampant in the community and that masking will be the direct way to affect that rampant disease, those 2 tests don't exist, then he's not confident in using Section 22 right now in this instance. I support his judgment on that. It's a mighty authority to wield, and I think that Dr. Mackey respects the authority there. This is about public safety. Municipal council enacts bylaws all the time about public safety, speed limits, things like that. This is another aspect of public safety. When we heard at the beginning of the meeting that the goals from the beginning, from Public Health Canada down to the Ontario government to our local approach, the goals in the COVID response have been preventing death, preventing serious illness, and minimizing economic disruption. And I think that this bylaw helps to move us closer to achieving those goals. When we had our Board of Health meeting last week, we heard very clearly from the municipal councillors from the county who sit on that board that they support mandatory masking in their communities, and they're hoping to have the same kind of support from their municipal councillors for a bylaw. They would have preferred a regional approach, and that because they don't want this uncertainty of having to pass this through their councils. But Kelly Elliott, in particular, the deputy mayor of Thames Centre, spoke very clearly and said she had been approached by businesses saying, or by shoppers saying, if Thames Centre doesn't enact a bylaw, those people will shop in London because they would feel safer to do so. That's just one individual, one anecdotal example, but this is the kind of conversation that's happening in all of the municipalities across the region. I think a bylaw, together with the Section 22 order that Dr. Mackey did enact, together with the instruction under the Emergency Management Civil Protection Act, is all of us using all of the tools at our disposal. And our bylaw is the tool that we have the power to use here at the Municipal Council. As others have said, this is a compromise. I have concerns about the end date that we have chosen. I chose to vote in favor of the amendment because I think the compromise is important. It's important to get this bylaw passed. And we, as part of our education, we have to continue to stress the reasons our numbers are low, the reasons we are where we are, the reasons we're moving into phase 3 is because we maintain those physical distances from each other and we did good hygiene like hand washing and things like that. We got to phase 3 also because we stayed home. We stayed home. We didn't celebrate with our families at Easter. We didn't see our mothers on Mother's Day. And things like that. We limited our gatherings to 5. Those gatherings are going up. The allowable numbers for those gatherings are going up. Masks are an important tool to bring in now that we're relaxing some of those other things that some of those
30
other
seconds,
protections
Councillor.
thank you. Some of those other protections that we had in place. So I think that this is a good bylaw. I think it's a good tool at our disposal, and I will support it.
Thank you. I've got Councillor Van Holst.
Thank you, Your Worship. Deputy Mayor Helmer said that this amount of coercion is worth the potential marginal benefit. And I don't know that I see it this way. Where I might have felt good about wearing a mask because I was helping other people, now I'll be more thinking that I better wear a mask or there's a $500,000 to $100,000 fine. I don't know that was necessary, and I don't believe it was necessary. Now, I was pleased with what the chief medical officer did with his July 18th instruction. Londoners wanted the potential for more cases and the spread of COVID to be addressed. And I think he addressed that with the order. And I went out on the weekend and I saw it in effect, and I saw that it was working well. And that was the escalation that we needed. And right now I see this as a double escalation. It's more than we need right now. People are saying that this is urgent. I don't see the same urgency when because we could have put this off for a month to see how things were going, and I think that would have been fine. And it would have given us a chance to clear up some of these issues. It would have provided the opportunity for those who are against such a motion to have an opportunity to speak to council. So for that reason, I'm going to point out that since this is not unanimous in terms of Londoners, there's no reason for this decision to be unanimous here at council. And sometimes in the past, I've voted against something not because I thought it was a terrible motion, but just because I didn't think it was a plan that deserved unanimous consent. And when I hear all of the reservations that I've heard from my councillors, that would lead me to vote against this in order to have that happen. As I would say, for me, freedom is king, and I don't mean that. By that I don't mean some silly things people would want that to mean, but what I mean is that if we can get 95% of what we want without coercion, then we should try that first to see if it works well. Already with the 2 meter distancing, we achieved 98%. So we've gotten so much so far without being heavy-handed. I'm not going to support this because we could have waited a little while to see if people would do it without that. So there's going to be some people that are upset that we've done this. There's going to be some people that think we've overstepped our authority. We had an email that was from a person. She sent a letter requesting delegation to the CAPS committee. I'm not sure what happened to that letter, but she said she was from a communist country and that when Canadian governments overstep their bounds, that triggers her, that makes her feel something very visceral. And I don't know if we're respecting that in all our community when we're passing this at the speed at which we're doing it. So I had moved that we refer this. Had we done that, I might have been fine.
30 seconds, Councillor.
I appreciate your timekeeping, Mr. Mayor, and I assure you I'll be finished by that time that 30 seconds is up. So those are my points, and so for that reason, I'll vote against this motion.
Thank you, Councillor. Councillor Morgan.
Yes, just briefly, Your Worship. I know during the debate, question was raised about how this is different from what the medical officer of health's instructions give. I would say I think there's just a couple of key differences. With the municipality passing a bylaw, obviously the municipality will be fully involved in the education components of this, as well as support for the enforcement, and have the ability to levy fines in cases where that's warranted, where that might not be the case. So I certainly appreciate that it is aligned very closely with the medical officer of health's current instructions, but it does create an important role for the municipality to be involved in the supportive role on this issue. And like I said earlier, sometimes the best compromises are ones where not everybody is really happy with where it landed. That's because there are very diverse opinions on this, and I think we've done a good job of a council as carving those out over our time here. So I appreciate all the thoughts and discussions. The end is much richer because of the debate we have. So.
Thank you. Councillor Slee, I see your hand up. Is that you bad again, or do you actually have your bad, or do you have a question or comment?
My bad again.
Okay, that's very good. I don't see anyone else on the list. Perhaps I could ask the clerk to read the motion, please.
Thank you. Through the chair, the motion is related to the original staff recommendation. It has been revised slightly from what is in the staff report based on the amendment. The motion reads as follows: that on the recommendation of the city manager, with the concurrence of the medical officer of health, Middlesex London, the revised attached bylaw be introduced at the municipal council meeting to be held on July 21st, 2020, to temporarily require the use of face coverings within enclosed, publicly accessible spaces in the City of London.
Thanks very much. That's been moved and seconded. Why don't we call the question? Councillor Van Holst.
No.
Councillor Lewis.
Yes.
Councillor Slee.
Yes.
Deputy Mayor Helmer.
Yes.
Councillor Cassidy.
Yes.
Councillor Squire.
Yes.
Councillor Morgan.
Yes.
Councillor Lehman.
Yes.
Councillor Hopkins.
Yes.
Councillor Van Meerbergen.
Yes.
Councillor Kayavaga.
Yes.
Oh, I see Councillor Pelosa there. I apologize. Councillor Pelosa. I think you're frozen, Councillor. May we come back to you if you would just want to organize that. Councillor Hillier?
Yes.
Councillor Pelosa, are you able to?
Yes.
Thank you. I vote yes.
Closing the vote, the motion is passed 13-1.
Thank you, colleagues. That moves us to the final item, which is adjournment. I'll look for a mover. Councillor Hopkins, perfect. Seconded by Councillor Cassidy. Clerk, do you mind if we did a hand vote? Let's do a hand vote just for fun. Let's all turn on our videos there, please, and be proud, be seen. All right, all those in favor?
Motion's passed.
Thank you to Dr. Mackey, sincerely appreciated. Thank you to staff for your work and efforts here, and thank you to council for your endurance and your great commentary. Meeting adjourned.
Thanks, everyone.